Good morning, everybody. I'm Bob Sanborn. I'm President and CEO of Children at Risk, and we're real excited to welcome you to the state of Black children. I want to thank our sponsors today, Change Happens from Houston, Dallas Truth, Racial Healing and Transformation, the Prairie View University, Houston Area Urban League, the United Way of Tarrant County, the YMCA of Houston, and the Texas Family Leadership Council. Join Children at Risk and welcoming all of you in the state of Black children. I also want to thank staff at Children at Risk who put all this together. Jessica Bundage, I really want to thank her. Lindsay Wilkerson and Brianna Derry all worked very hard to bring us the day that we're going to have today. Tomorrow we have an advocacy day where we're going to hear from legislators and community leaders from all over Texas talk about policy and racial equity in our state. I hope you'll be able to join us. That's free. And while we can't be on the steps of the Capitol tomorrow, we're going to do it virtually. And we have a number of legislators that are part of this. Let's get on with our day. I want to introduce our MC for the day, Davika Kornbacher. Let me tell you a little bit about Davika. Graduate of the University of Houston and of Harvard Law School. She has a background as an engineer, as a minister, and now she's a big cheese partner over at Vincent & Elkins. But most importantly, she's the chair of the board of Children at Risk. And with that, take it away, Davika. Thank you very much.
Thanks, Dr. Bob. Well, I'm really excited to be here with you today. And I know we had a lot of things that happened in February for Black History Month, but I actually enjoy that we're having this in March, because this is the kind of conversation we want to have throughout the year, not just 1 month of the year. So don't want to take too much time, but want to say thank you guys all for joining. And I'm really excited for what we have to talk about today. I'll be sharing facts throughout the day and introducing speakers, but we also have a lot of opportunities for folks to engage in the chat. So though it's a webinar and you can't ask live questions, if you have any questions, make sure to put those in the chat. And please use the Q&A feature because it gives our staff a chance to see what's been answered and what hasn't been. So without further ado, I want to hand it over to Helen Stagg for some opening remarks. Helen Stagg, for those of you who don't know, is Chief Executive Officer of Change Happens. That's a community-based social service organization in Houston. It is also the largest minority-founded organization in the greater Gulf Coast region. That organization makes a difference in the lives of 65,000 clients that it serves annually. Ms. Stagg has had a long career in the Texas Health and Human Services Commission before joining Change Happens. And she's an internationally certified prevention specialist and was recently named, I like this part, Helen, was recently named one of the recipients of the Third Ward Go Champion. And that's an award for her dedication in spearheading comprehensive, resident-led, and collaborative community development in Houston's Third Ward. Helen.
Thank you very much, Davika. Good morning, everybody. To Dr. Bob, our distinguished presenters, and to all of you who have given us the privilege of your time to be here today. Thank you very much. Welcome to the state, the first State of Black Children's Summit. Dr. Bob, I want to thank you and your incredible staff for having the vision to create this summit and for extending the invitation to Change Happens to partner with you. It is indeed a precious honor. Throughout your 30-year history, Children at Risk has led the way to bring people together to confront structured systems of inequities and to drive change to improve and enrich the lives of children. I bring you greetings from Change Happens, our board of directors, and our entire talented team of staff who are doing extraordinary work every day. I'm grateful to work with them. Yes, Change Happens is one of the largest Black-founded organizations in the greater Gulf Coast region. We are a community-based social service organization. We use a holistic, empowering approach, serving people in a variety of ways, everything from homelessness to system-involved youth, to people at risk of and living with HIV/AIDS, addiction, and co-occurring mental disorders, for youth at risk for teen pregnancy, and people who don't have access to health coverage, and a host of other programs, not just in Houston-Harris County, but in 31 counties throughout the state of Texas. We dare to do our work every day in the midst of the struggle for equity. Recently, Change Happens launched our Good Life Outcomes program to have a greater presence in advocating for change. We realize that for too long, we have fueled moderation in our advocacy work out of fear, the fear of not having enough resources to sustain our organization, the fear of conflict, especially with funders, and the fear that anything that we did might be considered too political. This fear often results in moderation. This moderation perpetuates a status quo where we have accepted staggering levels of child poverty, high levels of uninsured people, and educational disparities. But we know that the time is now and that our children deserve much more. I'd like to share a short story from a book called Tattoos of the Heart. It was written by Father Gregory Ball. In the late 80s, Father Ball was sent to pastor a poor parish in Los Angeles. At the time, this community was known as having the greatest concentration of gang activities in the city. And he started a nonprofit organization there called Homeboy Industries. It was a gang intervention and rehabilitation program to teach, train, and employ gang members. But in this book, he tells a series of stories, and one of them was about a young man named Pedro. Pedro was filled with rage and resentment, and it was concealed beneath heavy drinking and addiction to crack cocaine. Father Ball would see Pedro every day, and every day he would offer him the opportunity to go to rehab, to get better. And Pedro would always gently decline. But after many months, one day Pedro came to him. He sought the father out and asked him for an opportunity to get help with his addiction. So Father Ball took him to a rehab center, and there Pedro began the slow work of returning to himself. 30 days into his stay, Pedro's younger brother committed suicide. He suffered from the same kind of chemical dependence as Pedro. But Pedro was devastated by his brother's death. And when Father Ball arranged to pick him up for the funeral, the father makes a point to let him know that he would be bringing him back to the rehab right after the burial. And Pedro says, "I want to come back." And he goes on to tell the father about a dream he had had the night before. In telling the dream, he says that he was in this dark, empty room, no light, no illumination, but he knows that he is not alone, that the father is there in the room with him. And he says, suddenly the father takes out a flashlight and he shines this light on the light switch on the wall. And Pedro says that he holds a steady beam on the light switch, pointing the way. Pedro understands in the dream that he's the only one that can cross the room and turn on the switch. So he makes his way across the room. He turns on the switch and a light follows. And he says, at this time in the story, he begins to weep as he was telling it. And he says that the light is better than the darkness. And he goes on to add that his brother must never have found the light switch. So we, all of us today, we possess those flashlights. Whether we shine that light that comes from research, from data and statistics, from advocacy, or the light that comes from giving hope and compassion, we can help lead the way. Today, you'll hear from remarkable presenters, and you will learn more about how we are failing our children and how we can do better. We must demonstrate to everyone, policymakers, elected officials, the business community, community leaders, that everyone has a stake in investing in our children. So I urge you to use the information shared today to work together to push for change that will result in letting every child realize that they are the light of this world. Thank you very much. Have a wonderful conference, and back to you, Davika.
Great. Thank you so much, Helen. And it is really true that, only we can find the light for ourselves and for those around us. One of the things I love about Children at Risk is it's a advocacy organization, but it's advocacy that's based on research. And so many thanks to our team who's pulled together these numbers to, as Helen talked about, kind of sober ourselves about where the state of Black children is in Texas. So as I share these facts, there's no judgment on them. It's what we were able to find in public data, but I urge you to take the time to think about what that means and what action you can take from today. So of the almost million children, Black children in Texas, as far as health disparities, 14.8% of Black infants are born preterm. Now that's compared to 10.8% of Hispanics and only 9.5% of white infants and other racial ethnic categorizations. Also, infant mortality rates have been decreasing over the last decade, yay, but Black infants are still twice as likely to die, with 10.9 deaths in 1,000 births during the first year of life. And I know that the other facts are on the screen, I won't read them all to you, but Dr. James is going to talk to us about equity in birth outcomes, and I think it's a very important conversation as we start our section on health. For those of you guys who don't know Dr. James, thank you so much for joining us. Dr. James is a retired obstetrician, gynecologist, and pediatrician. He's been involved in the care of underserved populations for the entirety of his medical career and continuing into his retirement. He's received numerous teaching awards and several local and national awards for his advocacy to achieve equity in birth outcomes. He was also the founder and medical director of the Kalamazoo County Fetal and Infant Mortality Review Team. He was an associate professor of obstetrics and gynecology and pediatrics at The Ohio State University, also a former senior policy advisor to the Ohio Department of Health and the executive director of the Ohio State University's Kirwan Institute for the Study of Race and Ethnicity. Dr. James, I'll hand it over to you.
Thank you very much for that introduction. Let me jump right into my presentation. I have a lot I'd like to cover in a relatively short period of time. Can you all see this slide okay? I'll take no response as a yes. So first off, my gratitude for being invited to participate in your conference. My wife and I have 3 grown children, all of them born in Houston, Texas. So we feel very close in a very personal way to this issue that you are discussing. Title of my talk, Equity and the Opportunity to Survive the First Year of Life. For those of us of African ancestry in this country, it is a dream deferred. To keep us on the same page, infant mortality by definition is the death of any live-born baby prior to his or her first birthday. It's important that people understand that that definition does not include abortions or miscarriages. And then there's the stuff on the right side of this slide that I think it's also extremely important for us to appreciate, that it's the most sensitive indicator we have for quality of life, for social welfare. So it tells us something about how various groups are doing. It's also a mirror, if you will, for where we live. So it not only tells us something about how a particular group is doing, but it also provides information to us about how our community, how our society is doing in terms of assisting and helping those of us who are experiencing difficulty. The Secretary's Advisory Committee on Infant Mortality, this is from the Health and Human Services Division, reminds us that the contributors to infant mortality are multifactorial. So babies dying during the first year of life is not just about high quality healthcare, but it's also about adequate food and good nutrition, safe and stable housing, a healthy psychological and physical environment, and sufficient income to prevent impoverishment. I hope all of you recognize 2 through 5 in this slide as social determinants, because it's extremely important that we recognize the contribution that those determinants make to the opportunity to survive the first year of life. And then there is this sentence at the bottom of this slide that is extremely important, that as such, our ability to prevent infant deaths and to address longstanding disparities in infant mortality rates between population groups is a barometer or a measure, if you will, of our society's commitment to the health and well-being of all women, children, and families. So with that as backdrop, let's look at some of Texas's infant mortality data. Now, we're going to look at data for a long period of time, almost 60 years worth of data. On this graph, what we see is the Texas overall infant mortality rate from 1961 to 2018. And during that period of time, as you can see, Texas has made substantial improvements in the opportunity to survive the first year of life, almost 80% during that period of time. Now let's disaggregate this blue line by race, and what we see is the black line on top being the Black infant mortality rate, the blue line, the one we just saw on the previous slide, the red line, the white infant mortality rate, and if you look toward the right corner of the slide, you'll see a green line in there representing the Hispanic infant mortality rate during that more brief period of time. Because our conversation this morning is concentrating on comparing Black to white disparities in health outcomes, we will get rid of the other data and concentrate specifically on the Black-white disparity in infant mortality in Texas. And of course, the first thing that I'd like for you to notice in this data set, remember almost 60 years worth of data, is the duration of the disparity, how long this gap is persistent. And take you back to that slide earlier, that the persistence of this gap tells us something about ourselves and our commitment to the health and well-being of all women, children, and families. Also keep in mind, because as we go through this conversation, you know, the most common explanation for the persistence in the disparity is that it occurs as a consequence of group level flaws amongst those of us of African ancestry. But we know that that's not the case. I haven't tried to make that case in this presentation. Just accept me that we know that's not the case. There's also been this underlying suggestion that the disparities occur as a consequence of genetic differences between those of us who are Black and those of us who are white. But we know from the Genome Project that that's no longer the case, that in fact, we are genetically 99.9% the same. I'd like to take that same data set and walk you through 3 characteristics of that data set during this morning's discussion. The first is looking at the disparity ratio. So if we start back in 1961 and compare the Black-white infant mortality rate, we see that in 61, Black babies in Texas died at 1.65 times the rate that white babies died. Fast forward all the way to 2018, and while both the Black and white infant mortality rate have improved, the disparity ratio has in fact gone up, so that in 2018, Black babies in Texas were dying at 2.2 times the rate of white babies. Our goal is to get rid of that gap, get rid of the disparity ratio. And so to help understand what I mean by that, I'm digressing to this Running Man slide. If our goal here for these 2 men who are running is for the runner who is behind to catch up to the runner who is in front, and we want to do that without allowing the runner who is in front to slow down, then I think all of us appreciate and understand that the only way for that to happen is for the runner who is behind to run faster than the runner who is in front in order to eliminate the gap. So it is with infant mortality. We have to get to a point that we're comfortable with the conversation that says that we have to improve the Black infant mortality rate at a faster pace than we improve the white infant mortality rate. And we have to do that without slowing down our efforts to improve the white infant mortality rate. Now, the thought of doing that has bothered a lot of people. I've given versions of this talk in 35 of our 50 states, and I regularly get the feedback, particularly from those of us who are white, that suggests that it would be wrong, immoral, and unjust for us to ever think about improving the opportunity of surviving the first year of life for one group more than we do for another group. But look at your own data. Texas has been doing this for decades, and we behave as if it's normal, as if it's okay, as if there's nothing wrong, as long as white babies and white people were benefiting more than Black people. If it was wrong for us to think about it the other way, then this is wrong too, and it underscores the importance of eliminating the gap. The second characteristic of the same data set that I want to introduce this morning is what I refer to as a survival time lag. You won't be able to find this in the literature. It's something that I hope by the end of the year we can publicize, but in brief, let me describe it to you this way. Look at the 2018 Black infant mortality rate of 10 deaths per 1,000 live births, and go back in time to find out when the last time was the Texas white infant mortality rate is what your current Black infant mortality rate is. That time lag, that interval, is 37 years. Now, think about that in terms of the trend of the almost 60 years worth of data that we have before you today. If we don't change this trend, if we don't speed up the rate at which Black babies have the opportunity to survive the first year of life, then what the state of Texas is telling those of us who are Black is that Black babies are going to have to wait until the year 2056. It says 36 here, but it's 56, to experience the same opportunity of surviving the first year of life as white babies did in 2018. We think that's wrong. We think it's unjust. And we know beyond any shadow of a doubt that we can do better. Now, I also want to walk us through how Texas has done in terms of achieving healthy people infant mortality rate goals. As you all know, by the time we got to Healthy People 1990, we said that by the time we got to 1990, we wanted our overall infant mortality rate to be 9 and our Black infant mortality rate to be 12. Texas achieved that overall infant mortality rate for white babies in 1985 in advance of the goal date. For Healthy People 2000, we said that by the time we got to 2000, we wanted our overall infant mortality rate to be 7, our Black infant mortality rate to be 11. Texas achieved this overall infant mortality rate for white babies in 1991, again, well in advance of the goal date. And for Black infant mortality, we almost got there, but not quite. For Healthy People 2010, we said that by the time we got to 2010, we wanted our infant mortality rate to be the same for everybody and for it to be about 4.5. Texas did not achieve that goal for Black or white babies by 2010. And of course, we have ended the decade of Healthy People 2020, where we said that by the time 2020 ended, we wanted all groups to experience an infant mortality rate no greater than 6. And as you can see, Texas achieved that infant mortality rate for white babies well in advance of the goal date, and of course, did not get there for Black babies. As of August of 2020, we announced our aspirations and goals where infant mortality is concerned for Healthy People 2030. And we have said that by the time we get to the year 2030, we want all groups to experience an infant mortality rate no greater than 5 deaths per 1,000 live births. Now, nationally, as you can see here from aggregated data from 2016 to 2018, whites, Hispanics, and Asian Pacific Islanders have already achieved our Healthy People 2030 goal. The two groups that have not, of course, accomplished it on a national level are African Americans and Native Americans. So these are the two groups that on a national level that we have to concentrate on. And we have to double down our efforts where these two groups are concerned, while we also pay significant attention to the other groups. How that looks in Texas is the following. If our goal is to achieve the Healthy People 2030 goal of 5 by the time we get to the end of 2030, then as you can see here, using our baseline data from 2018 with an Black infant mortality rate of 10, we are going to have to improve the Black infant mortality rate by 50% over this 12-year period of time. So you include 2019, 2020, and then the 10 years in the decade leading up to 2030. That means then that we're going to have to improve the Black infant mortality rate at a rate of about 4.2% per year. Now that gets to be very important for us to appreciate and understand, because in this 60-year worth of data, we've improved the Black infant mortality rate by 1.3% per year. So it means that we're going to have to triple the pace of improvement in order for us to have an opportunity to accomplish the Black infant mortality rate of 5 by the time we get to the year 2030. And keep in mind that 2 of those years have already passed, 2019 and 2020. We anticipate that by the time we get to the year 2030, that the white infant mortality rate in Texas will continue to be significantly less than 5. As a matter of fact, we think that by the time we get to 2030, the white infant mortality rate is going to be about 4. So that if in fact our intent is to achieve equity, that there's no difference in the opportunity to survive the first year of life by the time we get to the year 2030, then that means that the Black infant mortality rate in Texas over the 12 years, including 2019 and 2020, is going to have to improve at a pace of about 5% per year. That is 4 times the pace that Texas has been improving the Black infant mortality rate in this 59-year period of time that we have here. So I take you back to this Running Man slide to help you understand the concept. If in fact the runner who is behind is going to catch up to the runner who is in front, if we are going to achieve equity and the opportunity to survive the first year of life by 2030, that it means that we have to improve the Black infant mortality rate at a faster pace than we are improving the white infant mortality rate. And since we are talking about life and death, we cannot take our eyes off of doing all we can to improve the white infant mortality rate as fast a pace as possible. It says then that we have to double, triple, quadruple down on our efforts to improve the Black infant mortality rate. That bothers people, but that is our reality. And if we're serious about achieving equity, that's the page that we need to get on. And Texas needs to develop a plan now, prospectively, to give us an opportunity to reach that goal by the time we get to 2030. So what should our goal be? That's a big part of the question. And while health equity dominates our literature, it's important that we understand this statement from Nancy Krieger that social inequality kills, that it deprives individuals and communities of a healthy start in life, increases their burden of disability, and brings early death. That poverty and discrimination, inadequate medical care, and violation of human rights all act as powerful determinants of who lives and who dies, at what age, and with what degree of suffering. So it's important that we understand that while health equity leads the national conversation, we cannot achieve health equity without achieving overall equity, that ought to be our North Star, that ought to be the bullseye. But we live in a country that has worked real hard to limit opportunities for certain groups. And where African Americans are concerned, we see that in the form of neighborhood segregation and redlining, the hierarchical healthcare system that we have, school segregation, the prejudice in hiring and firing, incarceration rates, college admission rates. We also see it in immigration laws, and most recently now with the attack on the opportunity to vote. Here's the bottom line that I want you to appreciate. That racial disparities are not natural. They occur as a consequence of the way we built this country. They occur as a consequence of the way we manage race in the United States. And the only good news on this slide is that if we built it this way, then it's within our power to fix it. To achieve health equity and equity, there are 3 central components that we have to pay attention to. that we have to get to a point that we value all individuals and populations equally, that we have to recognize and rectify historical injustices, and we need to provide resources according to need. I remind you of the founding of Black Lives Matter when Alicia Garza, astounded by the acquittal of so many police officers in the death of unarmed Black people, made the statement that I continue to be amazed at how little Black Lives Matter. As you all know, that those 3 words became a slogan. That slogan has become a movement. I want to remind you all this morning of the last 4 words of that remarkable sentence, that little Black lives matter too. It's hard work, but Nelson Mandela's life has shown us that it's always impossible until we actually do it. Thank you all very much.
Thank you so much, Dr. James, for those sobering facts and for your commitment to illuminating the disparities that sit before us. I hope that we all can commit to making those changes. Now that we had a conversation about physical health, it's time to turn to a conversation about mental health. So just some quick facts on a survey that was done by the Substance Abuse and Mental Health Services Administration. Just the point of this slide is to say, look, it looks like we're not lagging far behind the US when it comes to awareness and access to mental health. But the question is, how often are Black families taking advantage of these services? Our next speaker, Dr. Jamie Freeney, is going to help illuminate it for us from the perspective of Black adolescents. So Dr. Jamie Freeney is a dedicated public health practitioner. She earned her doctorate in public health with a focus in community health practice at UT, a School of Public Health, and she currently serves as the director of the Center for School Behavioral Health at Mental Health America of Greater Houston. Dr. Freeney works collaboratively with school districts, public and nonprofit child serving organizations, institutions of higher learning. So she works in collaboration the same way Children at Risk does to really develop and implement equitable projects and policies that promote the well-being of school-age children. Dr. Freeney, I'll turn it over to you.
Thank you so much. Good morning, everyone. Can you hear me okay?
Yes.
Great. Thank you to the State of Black Children in Texas Conference Committee for the opportunity to speak on adverse childhood experiences and suicide among Black youth in Texas. Next slide, please. I am the director for the Center for School Behavioral Health at Mental Health America of Greater Houston. Our mission is to improve the prevention, early identification, and intervention and treatment of behavioral health issues among students. We work with over 30 school districts and more than 80 organizations in the Greater Houston community to promote systems change through collaboration, legislative advocacy, and consensus recommendations and professional development. Some of you may have heard of our evidence-based emotional backpack program, which is on the Texas Education Agency's list of approved mental health trainings for school districts. Next slide, please. Today's presentation will provide a partial overview of my study, Adverse Childhood Experiences, Depression, Resilience, and Spirituality in African American Adolescents. We'll also describe suicide trends in Black youth and ways to support Black youth's mental health. Next slide, please. The focus of my study was adverse childhood experiences, and I'm sure many of you have heard of them. The pyramid in front of you displays the mechanisms by which ACEs influence mental and physical health throughout a person's life. When a child's body remains in a state of fight or flight, it can impact a child's brain structure and can cause prolonged or permanent damage because the child's brain is still in development. The brain then begins to think that this hypervigilant state, this fight or flight state, this high cortisol level state is normal. So when a child experiences multiple ACEs over time, especially without supportive relationships with adults, parents, educators, the experiences can trigger an excessive and long-lasting stress response. And it is this disruption in brain development that leads to social impairment, emotional dysregulation, and cognitive problems. When these problems manifest in the home, well, we see these problems manifest in the home and in the classroom. When students are acting out, throwing chairs, yelling aggressively, we often tend to see that as a personal attack. However, that's the way the brain has been developed. That's the way they are coping with fear, with embarrassment or shame. And when they're perceived to be under attack, they do what they normally would do at home or whenever they're in that state of fight or flight to protect themselves. The social impairment, things like misunderstanding boundaries with friends, with peers, with adults, the emotional dysregulation, such as yelling, pacing, using aggressive behavior, and cognitive problems like difficulty focusing in class or comprehending information, reading, math. Those things can lead a child to adopt unhealthy risk behaviors, such as dropping out of school, smoking, alcohol abuse, poor nutrition, and risky sexual behaviors. And these behaviors are often accompanied by stress that we don't know about, things that they're not comfortable saying or sharing. And stress, in addition to these unhealthy habits, over time can cause chronic disease, mental illness, and unfortunately end an individual's life earlier than expected, as we can see at the top of the pyramid with early death. Next slide, please. The original ACEs study conducted by the CDC and Kaiser Permanente surveyed 17,000 middle-class white adult patients that were in their obesity clinic, and they surveyed them about events that occurred before their 18th birthday. The survey was composed of 10 questions that covered 3 specific kinds of adversity children often face in the home. These adversities include physical and emotional abuse, neglect, and various types of household dysfunction. The scale was scored by adding yes responses, which resulted in a score from 0 to 10. And of that sample, 64% had experienced at least one ACE, and 40% had experienced 2 or more. And what they found was that those that had 2 or more ACEs had poorer health outcomes like cancer, chronic disease such as hypertension, heart disease, diabetes, and they also struggled with mental illness. Next slide, please. We know that adolescents in urban communities have the potential to be exposed to more than just abuse, neglect, or household dysfunction. Therefore, in our study, we decided to use an expanded questionnaire that included additional exposures that affect youth from various socioeconomic and racially ethnic backgrounds. These additional ACEs that you can see on the slide include experiencing homelessness, neighborhood or school violence, being treated badly because of race. Also we included parental deportation. We know that's something that's prevalent among the youth in our community here in Houston, and also having a severe illness or injury, or losing a close friend or family member. Next slide, please. Here you can see the demographic makeup of the study sample. All participants were Black, a little over half were female, and about half were in high school. Of the sample, 51% reported experiencing 4 or more of those adverse childhood experiences. This prevalence is slightly higher compared to other samples of adolescents and provide new insights into the extent to which Black youth are exposed to traumatic events. Next slide, please. It's estimated that in Texas, 23% of children and adolescents have had 2 or more ACEs. And often national studies will use a sample that's reflective of the United States population. So Black participants on average may make up about 12 to 16% of that study population. However, in this study, although much smaller in sample size, it's comprised of all Black youth. And this allows a more intimate look into the adversities that they experience, especially those youth that reside within the greater Houston area. Next slide, please. So in this study, the most prevalent ACE reported was experiencing the death of a very close friend or family member. This aligns with the research that pinpoints grief as a prevalent experience among youth today. The death of a friend or family member was followed by experiencing being pushed, slapped, hit, grabbed, or having something thrown at them. Having seen or heard violence in their neighborhood or in their school, as well as parental separation or divorce. And so there are several possible explanations for these findings. Our study didn't go into the reasoning or look at what led to these most prevalent ACEs. But with respect to the death of a close family member or friend, we know suicide is increasing among ethnic minority adolescent populations. So that could be a reason for the grief. Additionally, compared to white populations, African Americans are more likely to die from chronic disease and cancer. When it comes to exposure to violence, we also know that exposure to community violence is what includes homicides, it's sexual assaults and robberies, and it's often common in low socioeconomic communities. On the right side, you can see the least prevalent ACEs among this sample. They include being pregnant or getting someone pregnant, having been detained, arrested, or incarcerated. And factors within this study population that may contribute to those least prevalent ACEs may be the church or religious teachings acting as a protective factor. And some of these are just less likely to occur or less common in this particular sample, such as homelessness or being in foster care. Next slide, please. According to numerous studies, compared to adolescents with 0 ACEs, those with exposure to 4 or more have increased risk for a reduced immune system, alcohol or substance abuse, and increased conflict with peers and family members. They score 3 times higher on depression, anxiety, and anger scales. They're also 3 times more likely to repeat a grade in school or drop out. And of those in my sample, 22% were at risk for depression. Next slide, please. If we remember back to that childhood, that ACEs pyramid, you remember at the top was early death. Suicide is the second leading cause of death among youth aged 10 to 18, both nationally as well as in the state of Texas. In a recent study on suicidal ideation and attempts in Texas, at a pediatric emergency department before and during COVID, we see that 15.8% reported past suicide ideation and 4.3% reported a recent suicide attempt in the past 3 months. This is one emergency department from one hospital, and these are likely the more extreme cases due to them needing a visit in the emergency room, but the numbers are high enough, and I do believe that they are indicative of a public health crisis. Next slide, please. So let's take a look at trends of suicidal behaviors among high school students in the US. White youth have historically had higher rates of suicide attempts and deaths by suicide compared to their Black counterparts. However, that's no longer the case. According to a recent study on adolescent suicidal behaviors by Dr. Lindsay at NYU, between 1991 and 2017, suicide attempts among Black adolescents increased by 73%, while attempts among white youth decreased. And this is according to an analysis of over 99,000 high school students nationwide. But it is worth noting that Black adolescents experienced an increase in rates for suicide attempts, despite the fact that suicidal ideation and suicide plans have decreased across all sex and racial ethnic groups. Next slide, please. Today, more and more young Black children, age 5 to 12 years old, are completing suicide. And recently, the Journal of Community Health published a study showing, again, the rate of death by suicide for Black boys has increased as well as for Black girls. Next slide, please. No one cause has been identified as the reason for the increase in suicides. However, there are factors in the lives of Black youth that could contribute to the increase in suicidal behaviors. Dr. Rita Walker and her research team at the University of Houston shared that Black youth too often receive messages that their lives are not valued, especially in comparison with their peers of other backgrounds. Also, compared with white students, Black students receive more detentions, suspensions, and expulsions in school. They have higher rates of arrest and incarceration, and fewer options for high quality education and stable employment. Other contributing factors include shame or fear of judgment in speaking out or sharing their feelings, navigating dual cultural context, being the only Black child in the classroom or in a neighborhood, or having a few people that look like you that are in your community or in the places that you frequent, as well as experiencing racism. Next slide, please. Decades of research have linked African American youth's high self-esteem and positive racial identity with their academic success, behavioral adjustment, and positive emotional functioning. So as we review how to support Black youth, see where you fit in. In supporting Black youth, we could increase the number of mental and behavioral health providers of color, increase awareness of the impacts of racism and discrimination, prioritize strategies that increase access to mental health services, looking at interventions that address the most prevalent ACEs, such as grief, like really supporting youth when they lose loved ones, whether it be friends or family members, a student, another student in the school. Also establishing partnerships between churches and schools and mental health providers to increase access, reduce costs, co-locate services, again, increasing access, and to reduce stigma around conversations around mental illness, and to train community members, parents on what mental illness looks like, what stress looks like, how to recognize it, and what to do about it. It's really important that we take these into account and that we really find where we as individuals can have an impact and can support the mental health of Black youth. We must all do something. And as Dr. James said, little Black lives matter too. Next slide, please. As I come to a close, I want to point out that the Center for School Behavioral Health at Mental Health America of Greater Houston, in collaboration with school district teachers and administrators, child serving agencies, and mental health professionals, reviewed and revised the original list of 37 consensus recommendations to effect changes in behavioral health for students. The education system plays a pivotal role in improving the mental health of Black youth and can improve this by requiring all school district employees to receive culturally responsive training in how to recognize signs and symptoms of mental health and make referrals, to implement strategies to improve school disciplinary policies, like reviewing discipline policies and exclusionary practices, reviewing and revising student codes of conduct, looking at those that are driving inequities, as well as conducting equity audits, just to really understand and see what's going on within the school district. Also offering opportunities for families and students and the community to receive education about the signs and symptoms of mental health. Offering ethnic diversity studies on campus. This certainly contributes to a positive racial identity. And recruit and retain educators in K through 12 schools who are Black, Indigenous, or people of color, so that this increases or contributes to feelings of belonging and community among students. Next slide, please. I certainly appreciate your time and attention for today. There's so much we could talk about, but with the limited time, I wanted to share just a bit about the ACEs and give some insight really into the Black youth population. Often, again, we understand and we see the things, the various stressors that are impacting the Black community. But it's really important to point out that Black youth, like adults, experience this stress. They've experienced the stress of COVID-19. They're experiencing the stress of social injustice. They see it in the media. They hear it among their peers. They're talking about it. So engage in conversations and really think about ways that you can encourage and support the Black youth in your life. And remember to take time to do something good for yourself today. Thank you.
Thank you so much, Dr. Freeney. I appreciate that you illuminated some very sobering facts, but also gave us ways that we can support Black youth. And I want to just echo the making mental health aware and reducing the stigma. I'm one of those people who grew up like, oh, that's not, we're Black. We don't go see a therapist. But now, with the job and life I have now, I am fine saying that I do talk to a therapist. So I think we have a road to hoe, but we're making progress. So thank you for sharing that. Our next presentation continues this conversation. We're going to go to Dr. Tiandra Gordon. She's the Vice President of School-Based Health at Legacy Community Health in Houston. And Legacy School-Based Health Clinics, I know that Dr. Gordon will tell you a little bit more about it, but it's primary care and behavioral health services for students and families on school campuses, which makes high-quality healthcare convenient and accessible to families. So thank you for that, Dr. Gordon. I know that you're also a licensed marriage and family therapist, and I say perhaps most importantly, a wife, mother of 5 children, and author of a parenting education book called Purpose-Filled Parenting. Dr. Gordon.
Good morning, everyone. Thank you so much for having me here to talk about a topic that is so close to my heart. I'm excited to be here, so let's dive right in. We're going to talk about the state of Black children from a mental health perspective. We can go to the next slide. So in order to talk about mental health in the Black community, we must first talk about the history of trauma that has existed in the Black community from generation to generation. I wrote a poem in my 20s called Who Am I? And throughout the presentation today, I'm going to give little snippets of that poem, but a little quote kind of talks about the idea that our ancestors were forcefully removed from their homeland and brought to America with chains and whips. That is how Black Americans started their existence in this country, enduring 10 to 11 generations of slavery in which they were not allowed to learn to read. Families were separated, bought and sold at the discretion of slave owners and slave traders who were motivated by power, position, money, privilege, racism. Enslavement ended and Jim Crow laws were implemented. These laws were a formal codified system that dominated the American South for 3/4 of a century, beginning in the 1890s. They were laws mandating the segregation of schools, parks, libraries, drinking fountains, restrooms, buses, trains, restaurants to the disadvantage of Black Americans, denying them the same privileges and rights as their white counterparts. The white majority that maintained control of major institutions ensured that there were laws and practices that continued to disadvantage Black Americans. Political campaigns were targeted as painting Black Americans as dangerous, as a group to be feared. And the resulting of all of that is the stage that we're currently in, the stage of mass incarceration. Next slide. Generations and generations of trauma that has existed collectively in the Black community, and children exposed to trauma can have the symptoms identified below. Dr. Freeney talked about it, these symptoms in terms of adverse childhood experiences. Another word for that is trauma. So feelings of helplessness, uncertainty about whether there is a continued danger, just an existence that has a perception that the world is not a safe place. A general fear that extends beyond the specific traumatic event and into the other aspects of lives, and difficulty describing in words what's bothering them or what they're experiencing emotionally, which can result in acting out behaviors. Next slide. Compounded on the generations of collective trauma in the Black community are the recent pressures. Long-standing systemic health and societal inequities have put many Black people at increased risk of getting sick and dying of COVID-19. I did a little, I like qualitative research, and so I interviewed some of our current legacy community health psychiatrists, therapists, pediatricians about what they're seeing in the Black community as they serve Black families during this time. One of the legacy psychiatrists said the kids are seeing family members pass away. We can go to the next slide. Another therapist said that a 16-year-old that she was seeing said that she's fearful, she's missing out on high school experiences, she's missing time with friends, making memories. One of our pediatricians, Dr. Tamisha Jones, said most of the kids I see are children of color, and they're doing school primarily virtually. They're missing the social interaction they were previously getting at school. Things that help balance children like sports and extracurricular activities are missing components to their lives. Next slide. So the isolation that the virus can bring, along with the potential to have lost loved ones, can increase depressive symptoms in Black children. Symptoms of depression can include feelings of sadness, hopelessness, or irritability, not wanting to do fun things or not enjoying the fun things that were previously things that the kids enjoyed to do. Showing changes in eating patterns, eating a lot more or a lot less than usual. Showing changes in sleep patterns, sleeping a lot more or a lot less than usual. Showing changes in energy, being tired and sluggish or tense and restless a lot of the time. Having a hard time paying attention, feeling worthless, useless, or guilty. Showing self-injury or self-destructive behavior. Next slide. Along with the COVID-19, current pressures that Black children are experiencing are associated with our current socio-political climate. One of the providers that I interviewed, she's a Black mom of a daughter in a predominantly white school, and she says she's lost friends because of all of this. Another psychiatrist, Dr. Damian Larkin, shared the kids that he's here seeing, 16 and 17-year-olds, have definitely struggled with all of the emotionally charging forces of the past year. The pandemic detached them from friends. The social justice movement and harsh rhetoric on full display has made them start to question, perhaps for the first time, wait, am I in danger? Next slide. This feelings of being in danger can lead to symptoms of anxiety in children. And those include feeling afraid when away from parents or home, having extreme fear about a specific thing or a specific situation, being very worried about the future, that bad things might happen, having repeated episodes of sudden, unexpected, intense fear that come with symptoms like heart pounding, having trouble breathing, or feeling dizzy, shaky, or sweaty, or what we often call panic attacks. Next slide. The good thing, a bright spot in all of this, is that healing up and hope occurs through connection. We have experienced these pressures, these stressors, these collective traumas together as a community. And as a community, we can also, the fact that we're experiencing things as a community contributes to our resilience. Next slide. The collective nature of both the struggle and the fight have helped Black people remain resilient over the years. During the civil rights movement, they marched, they sang, and they preached until their voices were heard, with the emphasis on they, together. That promotes resilience and healing. Next slide. Black people have continued to fight for freedom and equality in this country collectively. Teens are finding social support for important causes through social media. Reducing feelings of isolation, feelings that I'm the only one dealing with this, can help children and teens overcome the negative mental health effects of trauma. Next slide. Other bright spots and highlights of our current socio-political climate, and this is a line from the poem that I discussed earlier. I learn because of their struggle. I rise because of their strength. More and more of our children and teens are learning through the struggles that they're seeing, through the stories that they're hearing, and it is contributing to them being more informed and more aware of their experiences. Black children are more engaged in what's happening around them in the world. They're asking more questions. They're more likely to discuss and appreciate their ability to vote. Black children are asking more questions about how the government works. Black children and teens are engaging in more honest conversations with their elders about the way people of color are treated and the history of race in America. They are interested and attentive to learning about disparities and inequities throughout history. They have learned how their grandparents and great-grandparents were oppressed, and they're more engaged in their family stories of triumph. And so these ideas were from the interviews that I did of the legacy providers that talked about what they're seeing in their little Black patients and their teenage Black patients as a result of current experiences in the world today. Next slide. So where do we go from here? The answers are from a 2013 study that I did in which I interviewed Black fathers on the things that influenced the men that they became, and in turn what they thought was necessary in raising Black children. I really value the stories and the wisdom that come from the real life experiences that are gained through qualitative research. And that's where this wisdom and this experience derived from. The Black fathers indicated that they need same gender role models. When I was talking to the fathers and they were talking about the greatest influences on the men that they became, they talked about what they learned from their fathers, whether their fathers were present or not. They talked about their fathers during that time. So that was indicative that same gender role models are very important. What that can teach us about, what does that mean for parents, teachers in the community? Parenting figures should be intentional about ensuring that each child has same gender role models to emulate. Legislator can support mentorship programs. The second thing is that Black kids need a village. They need nurturing relationships focused on communication, self-esteem, discipline, connection, values. And so they need multiple people in their lives that care about them, that care about their welfare. That's very important. And after-school programs can be a great source for that. What else did these Black fathers indicated? They indicated that they need exposure. That there's significance in intentionally exposing kids to experiences beyond their immediate environment. The legislature can support this by funding cultural expedition programs, extracurricular activities. Black kids also need education. What we can do as parents, as teachers, as a community, place a consistent focus on education that begins early and persists throughout educational experiences. The fathers talked about that if the people in their life valued education, the adults in their life, then they valued it. And when the adults in their life didn't, then they didn't value it. So there's just a significance to adults valuing education. And the legislature can promote equity, accountability, and excellence in education. These Black fathers also talked about a critical juncture that they experienced in their lives. They talked about a time when they may not have started to make the best choices and they had to choose whether they were going to keep down that path or go down another path. It's normal in adolescence for kids to kind of experiment and make some negative choices, to do different things. And too often Black kids become pigeonholed into labels because of those choices. So it's so important that we as parents, as teachers, as a community, understand that teens may experiment with negative choices and that we don't write them off because of it, but we offer second chances. We offer support. We offer new opportunities. The legislature can promote restorative justice programming and school mental health programs inside of schools. Next slide. I want to end with a quote by one of the therapists that I interviewed, Dr. Antoinette Wilson. She said, also, I think that honoring their resilience would be very important. She said, this morning I met with the family and I prided mom on how she and grandmother had modeled so much strength and courage to the child during the pandemic and the storm. The things they did to maintain the integrity, and she was referring to the recent storm that we experienced, winter storm that we experienced in Houston. The things they did to maintain the integrity of their home, secure the essentials, rise against adversity. I mean, talk about taking advantage of teachable moments. Their child can look to them long after the crisis, storm, pandemic as their reflection and model of what a strong Black family looks like. So as a Black community, we have experienced much adversity and continue to, but it is our resilience, it is our resolve, and it is the support of the community, of legislature, that will help us to continue to rise and continue to excel in the midst of this adversity that we've experienced over generations. Thank you all so much.
Thank you so much, Dr. Gordon. I completely agree. Resilience is key in all the adversity that we face. Next up, we have a video from Byron Sanders. He is the president and CEO of Big Thought. For those of you who don't know, Big Thought is, it connects people and organizations to prepare youth and children in under-resourced communities for tomorrow's creative economy through quality in school, after school, and community partnership experiences. Please start the video.
All youth have inherent greatness. Too many youth grow up in an environment where systemic inequities in housing, education, workforce, the criminal justice system, they leave youth to believe that their own greatness isn't there. At Big Thought, our North Star is to create a world in which all youth in marginalized communities are equipped to imagine and create their best lives, their best world. All youth. Our definition of marginalized communities is that we are looking at race and income. Those are the primary differentiators that we see in outcomes for young people. Equipped, such a critical word, because what we're saying is that it's not about what we're going to implant in them. It's about us acknowledging that they have desires, a vision for the world that they want to see ahead of them. So our job is to give them the tools so that they're both empowered to imagine first, then go out and shape that world. We work toward that vision by empowering youth to build their creative muscle, build social and emotional skills and well-being, and to discover and shape their unique and authentic voice. And we work in marginalized communities because what we understand is that also, if we're going to create the kind of equitable world we need, we're going to have to address the world around our young people. Make sure that they have the right tools and conditions so that that greatness can shine through.
Thank you, Byron. I appreciate those thoughts. And as we close this segment, I want to move to the next section of our program on criminal justice and Black children. And just to share a few facts with our latest data that we have available just from 2015 to 2017, that detention rates per 100,000 juveniles was 171 for Black youth. Now that's compared to 44 for Hispanics and 29 for white youths. And then from grades 1st through 12th, Black students made up between 12.5% and 13.1% of all Texas students, but they made up for 47% to 22% of all students enrolled in disciplinary alternative education programs. Black students, unfortunately, also have the highest rate of dropout, with 2.1% who dropped out between 7th and 12th grades during the school years of the study. And then that number jumps to 5% for Black students who are enrolled in those disciplinary alternative education programs. Next up, to kind of continue this conversation, we're going to have a couch conversation. And it's going to be a conversation between Tanya Rollins and Dr. Camille Quinn. And I'm just going to do quick intros, ladies, and then I will hand it over to you to have the conversation. Tanya Rollins is currently the Child Protective Services Disproportionality Manager for the Texas Department of Family and Protective Services. She's worked in the Texas child welfare system for 30 years. In many roles, investigator, intake specialist, any role you can think of. She received her BS in psychology from Texas A&M University and her master's in social work from Texas State University, San Marcos. Dr. Quinn is an assistant professor in the OSU College of Social Work, and she's a licensed independent social worker in Ohio. She's a principal investigator of a mixed methods pilot study with local providers and young adults to explore the effect of trauma and structural and systemic barriers on Black, African-American young adults with crime dissidents. She was reappointed to the Ohio Governor's Council on Juvenile Justice for a second 2-year term this year. Congratulations, Dr. Quinn. And and she's also appointed member of the Juvenile Justice Subcommittee of the Ohio Supreme Court. I'll turn it over to you, ladies.
Thank you. And thank you for having us today. as was stated, we are going to have a couch conversation today, and we could probably go on for hours, but we're not. We are going to invite you to join us in our couch conversation and use your QA field to ask us any questions. And so we're going to go ahead and get started. So Dr. Quinn, we have been talking about all morning at this wonderful summit about trauma and the disparities and so forth with our Black children. What does disproportionality look like in the juvenile justice system?
Thank you so much to earlier for that great introduction, and to you, Tanya. I'm pleased to be here with you today. I love to hear people that have such an extensive background in their areas of expertise, so I'm in great company. Thinking about disproportionality in the juvenile justice system, first, it should be noted that this has been a major concern, not just for juvenile courts, but for the US Department of Justice as well, because of these gender and racial disparities. In thinking of a way to define disproportionality, the Office of Juvenile Justice and Delinquency Prevention defines it, or what they call disproportionate minority contact, DMC. It is the extent to which specific racial groups are overrepresented at any stage of the juvenile justice system. And this was last defined in 2014. Now, the reality of the situation is that when they're talking about this overrepresentation, they're primarily talking about Black and brown youth. And they suggest there are 3 reasons for this. And some I could take issue with, and we may do that. You may as well, Tanya. So the first is this differential, what they call a differential pattern of offending across these racial groups, which leads to this disproportionate number of arrests. And that's based on a disproportionate involvement in specific types of illegal behaviors or subcultures of violence. I would argue or push back some on this and say that there's also been a criminalization of what I would call girlhood. I was a young girl in high school, even middle school. I might be playing on the playground during recess, jumping rope. Maybe somebody missed my turn or something, and we might have an argument. And that might look a lot of different ways. The teacher or whomever is out there supervising would usually walk over, have a conversation with us, and it would be resolved. Today, schools have school resource officers who are really like local police in the schools. And these individuals, in most cases, will in fact arrest young people depending on the behavior that is exhibited. And in some spaces, the behavior is irrelevant because of the race or gender of the individuals who are in question. That in and of itself could give you a good indication of how this pipeline to the juvenile justice system can be supported and even promoted. There's also this discussion about differential treatment, which is a result of race-related selection bias, what some scholars call explicit and implicit discriminatory practices based on negative stereotypes that influence the experiences and treatment of ethnic minority youth. This is pretty standard across the board. When you look at youth of color across gender, there are stark differences in how those individuals are treated throughout the system. Some young people don't even make it into the system. So for example, you might not ever know of X number of youth in a certain suburban community, and I'm not trying to stigmatize a community, but I just want to give you an example, who could in fact be out after curfew. Maybe a local patrol for the neighborhood comes up, they see the young people, say, hey, why are you outside without your parents? Oh, we're on our way home from a game, or we're going here to do this or do that. They let them go, won't even escort them home. Change that neighborhood to say a neighborhood where I grew up in Chicago. If that were to occur in my old neighborhood, which at that time was probably more like a suburban neighborhood, it would be a very different outcome. So the way that disproportionality in the juvenile justice system looks is really based on what happens in the community. So I'll just wrap up with the last reason that they offer, which is this differential treatment that's based on targeted policing and the enforcement of specific policies in different settings. So zero tolerance for violence in schools, zero tolerance for violence in communities. In some communities, they've seen an uptick of charges or offenses of battery because of instances that occur in the home between, say, the child and the parent or within siblings. The arrest never really should occur because it's obvious that these families need help. And in many places, there are agencies that could provide services to address the circumstances that are going on in those households. But again, the criminalization of behavior is what is directly tied to the justice system as a whole.
Wow. So it's very interesting because we have this overlap. So when we talk about the disproportionality in the juvenile justice system, and we talk about disproportionality in child welfare, it's those same factors that get people to the attention of child welfare. So when we talk about the facts that African-American children and families are more likely to be reported, more likely to be investigated, more likely to be removed, less likely to be reunified. Although here in the state of Texas, we are making some progress on that, we still have the less likely to be reunified. We are more likely to be placed with kin when we are removed from our homes. But when we get to the point of adoption, African-American children are less likely to be adopted within 12 months of termination of parental rights. And it takes longer for African-American children to get to that point of adoption. And when we ask that question of how do they overlap, it's the same systems. It's the same systems that you're talking about. The same systems, when you talk about the criminal justice system, you have to acknowledge that our three mandated, top professional mandated reporters in the state are the school system, and we've talked about that school to prison pipeline, law enforcement, we've talked about the overcriminalization of behavior, and then the medical profession, which Dr. James spoke so clearly of this morning. Those same systems provide entry to the child welfare system, provide entry to the juvenile justice system. And oftentimes what we have is those crossover youth, those youth who are now part of the juvenile justice system, as well as being part of the child welfare system. And then the systems aren't talking to each other, because we know that we have this issue in which we begin to look at different systems and how we work in isolation. And so it's usually primarily that judge who is our family court judges are usually our juvenile court and child welfare dockets. So they become very familiar with our kids that are appearing on both dockets. So when we really look at this, and this really brings us to how did we get here? And my short answer is always going to be systemic racism and a lack of accountability to systems for the outcomes of Black children and what that looks like. And Dr. James talked about our social determinants that we have to take into account. And here in Texas, we've seen that with COVID, we've seen it with the recent storms. Like, we continue to see how Black and brown communities, what the outcome looks like, right? We also know that Black and brown communities are over-surveyed, right? There's over-surveillance. So when you're asked how we get here, and one of our questions is not only how we get here, but how do we move beyond a conversation? So we're having a couch conversation today.
Right.
So one, how did we get here? And two, what needs to happen next?
Yes.
What needs to happen?
Absolutely. So I guess my short answer for how did we get here is simply slavery and the lack of implementation of Reconstruction, both the first and second times. And currently there is an attack on that ill-fated implementation of Reconstruction that was in fact implemented. So to underscore it a little bit and then move into what we do next, we need to be clear about slavery and what it means today based on what it meant then. There's a group called Town Law Center who did a report based on a study. They surveyed adults across the country in focus groups and asked them questions about young Black girls and young white girls, just girls in general. But what they found was that adults in general see Black girls as if they're adults. They don't see them as children. They don't see them as needing nurturing. They don't see them as quote unquote innocent. This is not by chance. This is a historical carryover from slavery. And Dr. Joyce DeGruy, who is a social worker, wrote a book called Post-Traumatic Slave Syndrome. And in that book, she talks about this issue. And she gives an example of a mother who is a slave, and the slave master comes to her and says, hey, Mary's coming along really good. Mary is her daughter. She knows that if she confirms what he's asking, then that means that that master is going to at some point have his way with her daughter. So instead of saying, oh yes, she's doing great, she's gonna say, she said, no, she's dumb, she's stupid, she can't work, she ain't good at all. That is the perspective that carries through every system you mentioned, Tanya. In the child welfare system, that is how Black mothers are perceived. That is the gender bias, right? It is the same thing in the juvenile and criminal justice systems. Black women are perceived as problematic, angry, aggressive, and it all stems back to those experiences of the past that have never been reconciled. So how do we do something different? What do we do? I think the two things that we could do, one is recognize that we have not really focused on certain populations the way we need to. In particular, Black girls and Black women and their system involvement. The primary focus has been at the individual level, not the structural or systemic level, as you pointed out. Really understanding what systemic racism means. When we look at interventions, particularly for justice-involved populations, the focus is around the individual, their behavior, whether it's this one criminological approach called risk, need, and responsiveness, or a more recent effort around reentry, the 5 keys. These are all efforts to focus on the individual and what they're doing. And what we need to do is shift or balance the focus so that we understand the influence of structural and systemic factors that influence directly and indirectly, not just the individuals, but providers like you, Tanya, like individuals on this call, like myself as a researcher. And if we're going to focus at the individual level, could we at least ask the individuals what they need and utilize that information to adapt culturally specific or tailored interventions that are responsive to them, instead of saying, oh, what I used to hear as a practitioner would be, yeah, this person is non-treatment adherent, they're not responsive to treatment, they're not in compliance, when in actuality, the intervention is not suited for them. How about shifting the narrative from trauma to healing? There's an individual named Sean Jenwright, who's an African-American history professor. He came up with healing-centered engagement as a response to trauma-informed care. because most practitioners don't know what trauma-informed care means in a practice setting, whether they're doing an individual session, a group, or they're working in a community. Whereas healing-centered engagement is this collective approach to think about how you tap into an individual's desire and approach to healing, and you leverage that. You can leverage it in an individual, you can leverage it in their family, you can leverage it in a community. And then you engage them around how they can sustain that healing process. So those are just some of the things that I think we could do. If we had more time, of course, we could go into way more, but I'd love to hear your thoughts as well, given your experience and what you have been thinking about, especially in terms of systemic racism.
You know, you were speaking my language, so let's just start there. It's really, you know, it's such a complex issue, a complex answer. One of it is, I think you hit it head on. We stop with the victim blaming. We stop with solely looking at trauma from an individualized perspective, but we also look at institutional related trauma. And that is the trauma that institutions such as the one that I work in, how we are inflicting traumas on families on a daily basis. Also, how we act as gatekeepers within the institutions that we sit in. And just because I'm a Black woman in a position talking about disproportionality doesn't mean that I have not been socialized in the concept of whiteness and I'm not acting as a gatekeeper and doing the same things. Now, another piece is we need to begin also really doing work with the community organizations that are on the ground. This conference summit was sponsored by community organizations doing the work on the ground. There's a group in Austin called Measure Austin, and they have been doing quite a bit of work on exactly what you talked about, Dr. Quinn, the adultification bias of Black girls and what that means and how it plays out. And in child welfare, part of my job has been trying to get that message to our foster parents, the people that are taking care of our children every single day, to our staff. Really, when we talk about is really understanding how not only our past laws impacted the work that we're doing and how we move forward and the systemic policies and practices, but also how do our current ones. One of the big movements, or I won't say big, but one of the movements out of Minnesota is for essentially a law that mirrors the Indian Child Welfare Act. And for those of you who aren't aware, the Indian Child Welfare Act is the federal act which tells us that we have to make active efforts to prevent the disruption of a Native American family. And so there's a movement out of Minnesota that says, and I think this is probably like the third legislative session they've brought it up, but it's to say, let's take that same law and apply it to Black children, because we know that Black children have disparate outcomes across every system. And in this country, when you look at it at a federal level, it's Native American children and Black children that have the worst outcomes typically. And so what would happen if we took this concept of active effort that has been put into law for Native American families and actually did it for every family? What if our motive was we will do the very best? The other piece is we have been doing quite a bit of work on doing mandated reporter through a race equity lens, and also this concept of support, not report. And it's exactly what you said about you have communities in which parents are given the benefit of the doubt and a report is never made. Black communities don't typically have that. when we look here in Austin, and I can do it for probably almost every jurisdiction in Texas, when I look at the zip codes where the primary removals are taking place, they're typically going to be Black and brown neighborhoods, and you can probably trace them back to the historical segregation of that city. When you look at Austin, it's east of 35, and we can talk about the 1928 plan that segregated Austin, but I also have done it for Dallas, and you can do it with the segregation plans of Dallas. So really looking at who are we actually bringing to the attention of these two systems, juvenile justice and child welfare, and looking at the history of those organizations and how it looks. We have a question. Would a national or state level push for immediate actions for reparations for Black people and families be an effective approach to positively impacting the issues addressed in the summit today? Ooh, that was a long question. What do you have, Dr. Quinn? What's your response to that?
Sure. I think that given that we just passed a $1.9 trillion Rescue Act in the country, which has been likened back to the size or magnitude of the New Deal, I believe there is potentially, especially at this moment right now, because we are at hopefully the end of a culmination of probably one of the most tragic and horrific years in all of our lives in a century. So I believe that there may be, despite the polarization that we see in our government, there may be goodwill to entertain, discuss, and consider what this potential for reparations could look like. The reality of the situation is there are discussions that are going on right now about reparations. Dr. Derek Hamilton, who is now at CUNY University in New York, has talked about baby bonds. There are many other scholars who have talked about what it looks like. And of course, there are detractors. But what I believe is needed is for organizations like the NAACP, the Congressional Black Caucus, as well as individuals who represent communities across the country to look at where we have been. We could take the dollars for, if you think about the dollars that have been expended in suits for wrongful death, okay? I believe the case for George Floyd resulted in $27 million to that family. There's a price to be put on his life, Breonna Taylor's life, Sandra Bland's life, or any of the individuals who have died as a result of state violence. However, if we had, say 10 years ago, before Trayvon Martin, before Diablo Abdul were in fact murdered, because it was murder, before that happened, had we had this conversation about reparations, might communities look different? Might Tamir Smith be alive because where he was playing would not be perceived as a haven for violent behavior? I believe that that is a reality. What we have to do is come together with an action plan that is grassroots based, but connected to larger policy and government systems so that we can push the narrative, the correct narrative that will follow with the discourse that could lead to the outcome that would be favorable. So I think it's possible.
I agree. And as we wrap up, because I got the message that we should be wrapping up, we had a question about what recommendations to school personnel, school resource officers. And like Dr. Quinn, I typically say school resource officers are law enforcement, and I like for us to call it what it is, essentially. I always say, and I usually end with this, do the work. So before we jump to what do, do the work, do the homework, learn about the history of your community, learn about the history of racism in this country, learn what is impacting the students that you are dealing with on a daily basis. And what that means for most people is relearning what you were taught from kindergarten through 12th grade and your college years, and taking a different point of view. But do your homework first, and then we can begin talking about how you jump. And also, when you're making reports, ask yourself, are you reporting all families equally? Or are your biases coming into play when you make that report? Dr. Quinn?
I was just gonna, I love what you said. And the only thing I would just add on or amplify in your response to that question is what you said a moment ago: support, not report. Figure out what's going on first, and then engage in support. And if needed, report. But really think about what the factors are that are going on in this point in time before you make that report, and make sure that it is the right next step. And,
so
and thank you all for your time. It's been great. And I just put my contact information in the chat. Tanya can do the same, but feel free, go ahead and bring us home.
Yes, Dr. Quinn. I was just about to say thank you all. I feel like we're at the Apollo and the little person with the, what do you call it, stick is about to come out.
Get us.
Yes, and pull us off stage. We thank you for having us today. This is a very important summit. And yes, I love the fact that we are having it in March and not February. And let's have one every month of the year.
I love that. I love that. So thank you guys. And I've got a new theme now: support, not report, when it comes to really reducing the disproportionality in the juvenile justice system. So thank you, ladies, for a very engaging conversation, which we hope you will continue in the chat or contacting Tanya or Dr. Quinn at another time. So now we're going to move to an in the field perspective, right? Like on the ground, folks. It's going to be an interview of Shawana Carter that it's going to be done by Jerry Hawkins. So just to give you an overview of both these individuals, Shawana Carter is the founder, and I love this, chief hope dealer of Carter's House. She's an entrepreneur and she's an advocate for low-income parents and children. If you look at her full bio in the materials, you'll see she also considers herself a lover of smiles and purposefully positive, which I need to work on. Becoming a teen mom at 17, she has valuable firsthand knowledge of the hard days and hard nights, but also the reward, she says, of seeing that, you know, you can, when your children start to begin to grasp that what you're doing is making a difference. And she's been passing that on to others. Jerry Hawkins is the executive director of Dallas Truth, Racial Healing and Transformation, which is part of a national 14-place initiative by the W.K. Kellogg Foundation. Mr. Hawkins is also the co-founder of the Imagining Freedom Institute, a national research-based leadership group. Most recently, so Jerry's been appointed to many things, but I'll say, I just want to share this, is he's recently selected as one of the 500 most powerful business leaders in North Texas by D Magazine. So please bring that power to us, Jerry. I'll hand it off to you to interview.
Thank you so much. I really appreciate you, and very excited to have a conversation with my partner in this work, Shawana Carter. How you doing, Shawana? I think you're muted, so we're gonna just take off mute. That's the motto for this right?
No, I'm doing well, Jerry. Thank you for having me. How are you today?
I'm doing well. I'm really excited to talk to you about your work. You know, Shawana, this pandemic has been hard on a lot of us, but particularly our Black community in Dallas. I read an NPR article that stated that even during like COVID testing, Dallas was the worst Texas city for testing when it comes to communities of color. What are you, you know, first seeing, you know, as you try to do the work that you do in Dallas when it comes to the pandemic?
What we're seeing, first off, at its onset, it was a huge disparity, and we saw it quickly with the need. The majority of people who, when we initially had that shutdown last year, a lot of those people who had to go home immediately, those are the families we serve, those low-income, hard-working families, those people who are homeless and sleeping in their cars because they don't want to go to a shelter with their children. They were hit immediately, and the panic set in. And so even, it took a few days, and I think a lot of my community partners and myself started realizing this is going to affect us a lot differently than it will other communities. And where we look at Dallas and we assume that we are so affluent, we are, but we have these pockets where people who don't have basic needs. When they sent these babies home without thinking about these communities, especially like I'm in South Dallas, Jerry, and so South Dallas is 7 miles from downtown, from the headquarters of AT&T. And we have a whole community that has the worst internet service, 7 miles away from the headquarters of AT&T. Kids had no Wi-Fi. Majority of the houses had no Wi-Fi. They had no close access. We had kids. My main office is inside the MLK Center in South Dallas. We had children sitting outside of the library to be able to get their Wi-Fi to do their schoolwork. We had, DISD purchasing Wi-Fi devices to give out in bulk. We had, community organizations buying them so they could just give them away because we realized this was going to happen. So this onset of the pandemic, that was huge. And here we are a year later, and we're still seeing that same amount of need. Some of it has gotten a little bit better, but when I look at our families in South Dallas, now we're going to deal with the disparities in education. These babies who did not have, or don't have parents who graduated or are able to understand this homework you're sending home, and have now transitioned from being just the drop-off mom or the pick-up dad to now I am the counselor, the janitor, the teacher, I am the lunch lady, I am everything, and that's a lot. And so I've watched our families go through and try to figure this out. And we've tried to adjust as far as our services have gone. We started off doing diaper days with community partners. That was the easiest thing to do, quickest thing to make sure that babies have what they need. But over this last 12 months, we've seen that need has grown, and it's impacted the other age groups, because we have these kids who sat at home all day and they haven't had anything to do, and now they've outgrown all their clothing. And then you start thinking like, mama's got to go to work. Who gonna watch these kids? And it's just been a whole big circle. And it's just, snowballed, and it's going to continue. I think that as we continue through this, we're going to see I'm hoping that it's bringing light to what's needed, but I think we already knew it. I think we just didn't want to address it.
So let's talk about that. Let's give some context to the area we're talking about. At the work we do at Dallas Truth, Racial Healing and Transformation, our goal is to create a radically inclusive city by addressing race and racism. And when we talk about Dallas, a lot of folks, from out of town might think about places that are not even connected, like Dallas Cowboys who don't have a home in Dallas, or something that is not connected. About South Dallas and communities, particularly Black communities in Dallas, we have to know some of that history. South Dallas is adjacent, as Shawana really brilliantly talked about, adjacent to downtown Dallas. Is connected to a neighborhood, one of the first neighborhoods in Dallas called the Cedars. And it used to be a white neighborhood. After a lack of public housing in Dallas for Black communities, particularly after redlining, folks were trying to move into this white community in South Dallas, and proceeded to have a bombing campaign on Black homes in South Dallas from 1929 to 1951. After the desegregation orders in the 1970s started, white families left South Dallas, and it became almost 90% Black community. And we know when Black communities emerge in cities, cities start this process of disinvestment, right? And so community folks like Shawana have to pick up the slack Shawana, tell me why you actually started doing what you were doing at Carter's House, providing these essential things for families.
Sure. So I started this work Monday was my 8th anniversary. But I started this work 8 years ago to provide Carter's House as we started off as a clothing bank for children and teens. So we provide clothes, that's what we do. We give our parents a dignified shopping experience, cover them in love and care. And we started this work because 12 years ago, my husband at the time and myself found ourselves living in a motel with 3 of our 4 kids. And when it was time for school to start, we didn't have any money to buy school uniforms. I live in Irving, which is a suburb of Dallas, and our district was able to assist, and they were able to help with one of my students. My other student was already in 8th grade, wearing adult man-sized clothes. They didn't have anything that big. And so I had a luxury that most of the parents that I served didn't have. I called my mom, and I got some help. And so, 3-4 years later, my family is settled. We are doing well. We're getting back on our feet. And I realized that the programs that assisted me were for families that are having a housing crisis, right? And so for those families that are just in between paychecks, or, they're hardworking and they just don't have enough money. Oftentimes I say, you have more money than month. You have more month than money, and you realize that it just doesn't stretch. When you think, you look at the numbers that, Cliff, majority of people over there making like $16,000 a year, and your average family is 3 kids. Who can feed and clothe and provide shelter on that kind of money? It doesn't work. And so I went, 5 years later, we're settled, we're doing well. I have a moment, I literally pray and ask God, what's the work? What you want me to do? Let's go ahead and get to work. And so I started this work. I started doing this, and initially in my mind, I'm thinking it's not going to be that big, right? I'm thinking this will be easy work. I'll just give out some clothes. We'll have a good day. And it's always shocking, Jared, for me to say it out loud. But last year, in the middle of a pandemic, we served 3,500 children.
Wow.
In the middle of a pandemic, it was that many babies that still need it. And to be in a community where people still think like, even in the conversation that I have with funders for our organization, for them to still consider clothing not a basic necessity, my response is always walk around naked and tell them you don't go to jail. But think about the mom who is trying to figure out, how am I going to provide shoes for these kids? They can't go without them. And so this is, we do this work because I know what it feels like, because I've been there. But I also have children who were on that side. And so I know what those kids feel like when they don't have what everybody else has. And so most of the people we meet, the parents, they really are trying. It's not something where I'm just coming to get something for free. I'm trying to do something. It's just not enough. It's just, cost of clothing children is expensive. And so this is why we work.
No, for sure. So Shawana, to quickly tell us, what do you think we need to do better for our Black children? Whether it's the city, whether it's the county, whether it's the state of Texas, what do we need to do to change to do better for our Black children, particularly in the work that you do in emergency services and providing care for families?
I think there has to be a lot of recognition of the fact that there is a need, that there are communities that are being ignored, and stop pretending like we can sidestep that. And it has to be realistic. It has to be, the acknowledgement has to be there, but then it also has to be the education to the families on what is available. Like for a smaller organization like mine, to get the word out, when you have a large organization like Salvation Army who's not making the moves like we do, and they're not as known. So give us that space to move around and do those type of things. I think at a state level, the state needs to understand that when these things happen, these are the communities that get hit hardest. Acknowledge that and provide any assistance you can immediately. Don't make these people wait 6 and 7 weeks to get a check. If you are giving away money, make sure they get their money. Don't make them jump through hoops. When it comes to education barriers, acknowledge the fact that we have communities that do not have access When the pandemic happened, Jerry, I was on a call. I was in Leadership ISD, as a matter of fact, which is a cohort. I was a fellow, and we were talking to teachers who were teaching in South Dallas, and these teachers were unable to even teach their class because they had turned them as social workers because these parents could not figure out, where do I get food for these kids? Because they were eating at school all day long. I don't have food to feed these babies. Right. They were trying to figure out how, well, mama can't read, or they're living with grandmother and grandmama can't read. And so if you're going to if you're going to do a mandated order where everybody has to go home, realize that everybody's household is not the same. And if you're going to be equitable, acknowledge that you need to provide a way for these babies to have access. If it means that, yes, we have to close up the building, we can open up for these top 15 kids who need help 2 hours a day to come in and get your work done, then that's what you have to sacrifice. Because otherwise, you're going to end up with a whole set of kids who are left behind. And it's your fault. It's nobody else's, it's yours. Because you were well aware of what was going on and you still chose not to fix it.
For sure. And another reason why I wanted to talk to you is because a lot of times Black women doing this work on the ground for Black children and Black families especially don't get the recognition they deserve. You recently were awarded a local legend by Wild Turkey and Matthew McConaughey. Tell me about that experience and tell me, why you think, your work especially is so important in this time.
So the experience was amazing. And it's once in a lifetime that you come on camera and realize Matthew McConaughey is going to interview you. So, and of course, if he hits you with the all right, you don't know what else to do, right? But it was totally amazing. Receiving the award was a total shock. I didn't even know I had been nominated. And to be considered a local legend, and sometimes it's still like, really, it's me? But I also recognize that the work, not just the fact that I give out clothes, but the work and the way we do it, the compassion, the love, the care we provide, the assistance, but the push to continue on, to remind our families this is just a bump in your road and you'll continue on. I think that's what makes me the local legend. Sounds funny when I say it out loud, but it's yeah, I understand. I think that's the bigger piece that that makes it unique. I'm very dedicated in the way that we give out our services. I'm very, very particular. People who volunteer with me understand and have to go through a whole little session with me on how we talk to our customers.
I think we lost Shawana for a minute, but hopefully she'll be back. While we're waiting on Shawana to return, again, she, internet service is crazy. There we go. You back?
Yeah, I'm back. Sorry.
No worries. No, but thank you for sharing that.
Yeah.
We have a question from the audience. It says, being a member of Alpha Phi Alpha and you, Jerry, a member of Omega Psi Phi Fraternity Incorporated, what can the Divine Nine do to be more impactful and make a difference going forward to address these inequities? I think I'll address, and I hope that you can just share what you hope that the community in general can do to support the work of yours, so you don't have to do that work, right? I think that we all can step up, particularly, fraternities and sororities. Our organizations are built on service. And so more of us have to, step in that role of service, community service in a lot of different ways. It is not just doing the work that Shawana does, which is providing emergency services and food and clothing and the essentials that families need, but it's also advocating for more finances and resources for our community in multiple levels of government and also in the philanthropic area. Dallas has one of the largest philanthropic industries in the country, and still the large majority of that money does not go to southern sector of Dallas, which is also the largest part of the city of Dallas. So when we talk about Black people very specifically, we definitely don't get the, none of the percentage that we need in order to do the work that we're doing. So a lot of folks are really struggling. So we want to definitely support that. What do you think, Shawana, to close us out?
So I'll say this, two things. When it comes to the Divine Nine or other organizations stepping up, I need everybody to take a second. Remember, when you were a kid and your mama needed clothes or she needed help with a bill, where did she go for help? She went to a church. Mm-hmm. She called a neighbor. A lot of us wore hand-me-downs from cousins. That was the way it worked. And so this work that I do because those things stopped happening. And so there's always opportunity for any service organization or part of the Divine Nine to jump in and say, hey, we can do a drive, we can do a distribution. And I am not at all upset if you decide you want to take this thing over and go for it. I would be happy to tell you how to do it. That doesn't bother me. When it comes to funding, Jerry, as we close, always remember that the nonprofits that operate in the southern sector of Dallas, while we are doing a lot more of the work, I want you guys to think, and you can even take a chance and look back. When the pandemic kicked off, the 5 organizations that I work with in 5 months, we served over 1,000 children, and that was just diapers and baby wipes. That was it. Mm-hmm. We operated for almost 6 weeks before we saw any movement from the larger organizations in Dallas. And these are organizations who at that time had budgets of less than $50,000. We made it happen. And so then once we started to make it happen, those funding organizations began to say, oh, we should get you some checks. And that's wonderful. But the way we work for our money versus the way the larger nonprofit works for their money is totally different. And we have to respect the fact that even when our bank accounts are nil and we have minimum dollars, we are still going to do programming because our job is not related to how we feel. It is about taking care of our community. And so if you are considering, or if you work for a funder and you think about that, consider when you see those grants come through, ours may not look the best, but I promise you, we're going to do exactly what we told you we're going to do with that money.
No, I totally agree. And I want to add just a little bit more time to us to discuss this digital divide that you brought up.
Yeah.
Dallas is also the worst city in Texas when it comes to the digital divide. A lot of folks don't know like the disparities when it comes to Dallas. Dallas is some of the worst disparities in the country. Just 4 years ago, Dallas had the worst child poverty rate in the country for large cities. Dallas, according to the Urban Institute, had the largest income inequality by neighborhood in the country. Dallas also last for economic mobility by neighborhood in the country. So a lot of work to be done in Dallas, particularly the digital divide. And AT&T obviously is one of those people who we are pressing against. What do you see as a way to talk about what is really needed, particularly in a pandemic where everybody is virtual, even us, right, doing our work right now on the internet in communities that do not have the needed high-speed internet in order to have the services they need. And we're seeing that now with the vaccinations, right?
Right.
People of color don't even have access to sign up online vaccinations, and so we're being vaccinated less than every other community, particularly Black people. So what do you see as something that we can do to attack that?
I think we have to meet people where they are, Jerry. I know that we are all transitioning to this digital age, which we knew would happen eventually, but we have to realize that in communities where we have third and fourth generations raising children, everybody, has a cell phone, but we also still have grandmothers who think their phones are only just to make a phone call. And so you need to meet that grandmother where she is. Sending a notice from school via email to a person who doesn't even know how to log in doesn't do any good. And so I think, sending them home with a computer, even if it is a Chromebook, which is a simple, device according to us to use, I don't even know how to turn this thing on. I don't know what to do with this thing. There has to be some education. I think that right now, as we begin to transition back to what we term was normal, take the time to use this time to educate our parents and grandparents and aunties and uncles who are raising these babies on what could happen. We've seen what happens when nobody knows what to do. Now we have some time. Take this time and train them. Host a class at your school that says, hey, bring, grandmama, y'all come up here and we'll give a lunch and learn, and let's figure out to get these basics on how to check these things. I think that we have to take this time to be realistic and think that, okay, if it happened once, it could very well happen again. And this time, let's prepare. Let's reach out to internet companies, AT&T and anyone else, and say, okay, we need you to hit these areas where we know that these people don't have. You don't necessarily, like, I mean, Jerry, you and I have worked on Next Fest together, and I don't know that you've done the back part of it, but I've done it the whole time the event has been happening. So I have watched AT&T come inside a Fair Park and set up an entire warehouse building full of Wi-Fi equipment so we could access it, take it all back down, and then leave.
That's right.
And you telling me you can't put that up? Like, when this happened, y'all couldn't roll out to South House and turn these towers on quick enough to get these babies online? I'm not buying it.
It's not an issue of resources, it's an issue of willpower and
exactly
anti-blackness, right? So
yeah.
As we end, Shawana, where can we find out more about your work?
You can always get us on our website, www.cartershouse.org. I'm all over Instagram. Please follow Carter's House Carter's _ House. We're on Twitter at the same handle, Carter's _ House. And then you can follow my page, Shawana _ Carter. If you should have anybody that is in need, please send them to our Instagram page. They can send me a DM directly, and we will message back and get them scheduled for an appointment.
Awesome. Thank you, Shawana, for your work. You can find our work at Dallas Truth, Racial Healing and Transformation at DallasTRHT.org. And we're also on social media at DallasTRHT. Check us out and support Shawana and her work. Really appreciate you, Children at Risk, and support Black babies.
Thank you.
All right, appreciate it, guys. I wanted to yell preach, but I was still on mute when Shawana was talking. Thank you guys so much for that engaging conversation. And, look in the chat panel for the different links that are coming up that if you want to engage with Jerry and Shawana at a different time. So next we want to move to talking about education in Black children. Some quick facts here. In 2019, 86% of Black students graduated on time. Meanwhile, 94% of white students and 88% of Hispanic students graduated on time. And this one I thought was an interesting fact, but again, we report the facts. In 2020, according to a Kids Count data center and some other surveys, 98% of Black households had internet that was usually available. These numbers are actually higher than the same survey given of white and Hispanic households. And then in 2019 to 2020 school year, Black students received the largest share of in and out of school suspensions at 12% and 7% respectively. Again, no comments on the data. This is the data that our research team is finding, but I think, like Shawana said, it's about where you live and whether or not you're gonna have that access. So our next section is gonna be a panel, and it's gonna be moderated by Donald Bauer. So I'm gonna introduce Donald, and then I'm gonna let Donald do the rest of the introductions for his panel. So Donald Bowers is a native Houstonian. He received his bachelor's degree from Rice University and is still a proud owl, I will tell you. I hear about it all the time. He has an MBA from Sam Houston State University. After joining the Federal Reserve Bank's Management Development Program in 1991, he has now risen to vice president, and he has several responsibilities, including the bank's communications and outreach, law enforcement, and business continuity functions. He's also proud papa, and with this, Donald, proud papa of two outstanding young men. One is a lieutenant in the United States Navy, and the other one is a special education teacher in Pearland. Last but not least, okay, now I'm really done, Donald. He is the vice chair of Children at Risk. So, Donald, I'll turn it over to you.
Thanks, Davika. I appreciate that, especially the shout out to the two young men. Okay, sounds like is my video on now?
Yes, you're good.
Great. Well, I'm really pleased to moderate this discussion on economic impact of education on workforce opportunities in the Black community. Specifically, our panel will explore challenges facing Black youth entering the workforce today, ways industry is working to better engage Black youth, and we'll conclude with a discussion on what industry, schools, and communities can do to partner and create better workforce outcomes. Joining me in this discussion will be Dorian Cockrell and John Scroggins. Dorian and John, are you guys there?
Yes, sir.
Dorian?
Yes, sir, I'm here.
Great, all right. Well, by way of background, Dorian is a workforce operations manager for the Houston-Galveston Area Council. As an operations manager, he's responsible for providing strategic planning and direction for the public workforce system across 13 counties in the Gulf Coast region. He also serves on several statewide and regional education and workforce advisory councils. Among some of his awards and recognition is he's designated as a member of Nation Sewell, which is a council of members who work with other service-minded leaders across the nation just to find solutions to move our country forward. He's also a proud graduate of UT Arlington with a bachelor's degree in interdisciplinary studies and a master's of public administration. Next is John Scroggins. John is Senior Vice President, Community Development Lender for Allegiance Bank. John currently serves as a Senior Vice President there at Allegiance, but has over 39 years of experience in the banking industry, including serving as President and CEO of Unity National Bank in Houston, which is the only Black-owned bank in the state of Texas. Prior to that, he held numerous executive management positions at banks like Wells Fargo, Prime Bank, and First City. He is a graduate of Texas Southern University, and full disclosure, he's also been active with the Federal Reserve Bank, having served on our Community Depository Institutions Advisory Council. So John and Dorian, before we get started, I'd like to give you each an opportunity to thank your favorite or most influential teacher from your K through 12 time. Education is such a big part of what we're talking about today, and so I thought it would be good for the audience to know who you find most influential from your K through 12 experience. So Dorian, we'll start with you.
Oh, perfect. Thank you, Donald, and thank you for everybody at Children at Risk and having me on. I thought about this, and it just comes down to Coach Jordan, Coach Reuben Jordan. He was my high school coach at Clear Creek High School from 9th through 12th grade. He was my football coach. He was my track coach. He was mentor. He was the only, and still is, the only Black man that has ever been a teacher, whether it's just K through 12 or even in my university days. And so Coach Jordan showed me how to see a Black man in a positive light. I'm, full disclosure, from Sunnyside, South Park area here in Houston, Texas. And so growing up, I didn't have any positive influences close by. So going to school and seeing Coach Jordan and hearing him and having his mentoring, and he is the reason why I got through high school. He is the reason why I participated in sports. He's the reason why, you know, I graduated and went on to University of Texas at Arlington. He was a servant in every way. Unfortunately, you know, he passed away serving people in the aftermath of Hurricane Harvey out in the floodwaters. And so, you know, even to his last days and moments, he was still out in the community serving. And I'm just only one disciple from his leadership while he was at Clear Creek and over this time. And so I'm thankful for the question. I'm thankful for being able to honor and praise him publicly because Reuben Jordan, I wouldn't be here if it wasn't for him.
Great share, Dorian. Thank you for that. John, what about you? Who was the most influential educator or teacher during your K through 12 experience?
Don, yes, that's easy for me. It was Mrs. Aloysius Wycliffe. She was my English teacher, and she was so adamant that we spoke grammatically correctly until she would make you stay after class, after school, to make sure that you had your verb subject agreement in place, because she understood that in order to progress in the world, you had to be able to communicate well. And her emphasis, I would say, really set the tone for me to be able to have the skills that I needed to have in my particular career, and to matriculate through some of the areas that I've been able to do. She was, not only was she a good English teacher, she was a good role model as well, because she wanted us to be involved in lots of club activities in order to make sure that we understood the intermingling and intermingling of what we were going to do. So I would say that other than my parents, she set me on the straight course of being able to communicate well, and thus it enhanced my career. So, Miss Wycliffe, thank you very much.
Awesome. Thanks for sharing, John. And I won't go into all the details, but I'll give my my personal shout out to Miss Dolores Duffy, who was my 5th grade teacher at Wesley Elementary under the leadership of Thaddeus Lott. And those who know Houston schools will know the legacy of Thaddeus Lott. But Dorian and John, thank you for sharing that. You know, let's jump into this. You know, our topic is education and workforce. You know, and even before the pandemic, communities of color and Black communities, even more specifically, had the odds stacked against them when it comes to securing a job, earning a living wage, and building wealth. The Economic Policy Institute has estimated over time that Black workers historically earn 70 to 75% of what white workers do, even in good times. So given the state of the pandemic and the economy, what would you say is the biggest challenge facing Black youth entering the job market today? And Dorian, we'll start again with you.
Perfect. The biggest thing, you know, we're seeing right now is a lack of access to quality early education and childcare, as well as transportation. And you compound that with what COVID exposed with digital infrastructure and lack of the connectivity in some of the neighborhoods that our Black youth reside in. And all of those preclude our young people for opportunities to have good jobs and access to good jobs. I was looking at some research and talking to our principal economist, Parker Harvey, and last month, the unemployment rate for young people between the ages of 16 and 19 years old is 13.9%. And for Black youth between the ages of 16 and 19 years old, that number is at 19.8%. And so if you want to compare that to all races and looking at the struggle that we are facing to close that gap between 13% and 20%, we need to address issues around transportation. We need to address issues around childcare and access to childcare. We need to talk about opportunities to set families up for success and looking at wrapping around entire families from parent to child to be able to provide the skills for those young Black youth to obtain those jobs and retain those jobs. And so those are top lists as far as childcare and transportation, as far as we're seeing right now.
Thanks, Dorian. John, what about from your side? What do you see as the biggest challenges facing Black youth entering the job market, and maybe even more specifically, the banking industry?
Don, if I may, thank you. I would like to really focus in on the banking industry. I think I know a little bit about it. I've spent a lot of time. One of the big things that I noticed over the years was a lack of diversity, particularly in the higher upper ranks of banking. And as a result, in the Houston area, let's just talk about that for a moment. There are some 90,000 African-American owned businesses in Houston. And of that 90,000, only about 50%, about 45,000, have a banking relationship. If you don't have a banking relationship, you are not going to be able to carry on your business in a way that will make it successful, because you need that. So what I decided to do is to start a program, which is called the Future Bankers Leadership Program. It launches this coming fall at Texas Southern University Jesse Jones School of Business. What this program will do, it will educate, train, and prepare the next diverse generation of bankers. And in addition to that, the program is designed in such a way where we reach out to high school and junior high school students, because we want to introduce them to the concept early on and get them ready to be those that serve as a pipeline to go directly into the banking industry. And by doing that, we can produce, I think, some outstanding talent and convert it into the banking. For example, just a statistic here, Texas Southern University produces more African-American accountants than any other school in the state. And we are going to take those finance and accounting students and convert those over into the banking program, and thus we can have students ready to go. And then once we get them trained, we have a nexus with all of the community banks and some of the larger banks, whereby they will give them internships. And with those internships, you can project it out until actually careers. I don't say just jobs, but they will actually have careers. So we got that nexus by starting this particular special program geared towards bankers. Secondly, these same bankers that we're training can go out into the community and work with the African American and other minority businesses and make sure they have a comfort level with those that may even look like them in such a way that they feel comfortable and understand. And those bankers, trained as they are, can then help them to be able to form those relationships and help them to understand those relationships and how to make them work for themselves to enter that program where they can all have a banking relationship. It helps the banks on the other end because the business of banking is to provide services, not just loans, but other services that businesses can use. And so it's a win-win for everybody. You have a more diversified workforce. You have more access to capital from the small businesses, and we're reaching out into the high schools and junior high schools to recruit these students to go forward. So to me, that's a ripple effect of how we can impact the economy, from providing jobs to the students after they finish the program, helping the small businesses have access to capital and the banks, and thirdly, for the banks to provide services for them. So it helps the whole industry, and to me, that will have a huge impact for years to come.
Thanks, John. I've done some work on this with you from the Federal Reserve perspective, and we're very excited about what the program at Texas Southern. Right now across the state, there are about a half dozen banking programs, but the penetration into the Black and Brown community has not been as great as we would like it to be. And as we understand it, TSU would likely double the number of Black students graduating with degrees in commercial banking and being able to go into this field than what currently exists today. So you guys are really going to be impacting the talent pipeline there. Dorian, thinking about it from a workforce solutions perspective, what are some of the things that you're seeing from industry to better engage Black youth and provide them with career pathways?
I think looking at industry being involved, just like John indicated, working with local nonprofits. We've, heard today, the folks on the ground, they know, how to get the job done. And so industry, working with workforce development organizations that have access to some of these young people that need to learn about different occupations and different industries, whether it's through an internship or what we offer a work-based learning, work experience opportunity for in-school youth or youth that are out of really engaging and showing, these young people that there are different opportunities out there for them to go into and highlight some aspects of an industry that folks may not think about. I take construction for an example. Everybody throws construction out there as far as an industry, but there are so many occupations within construction, as far as healthcare, as far as finance, as far as customer service, as far as marketing, branding, social media. And so you don't have to be beholden to become a welder or a pipe fitter or a plumber. Those are great occupations, but what industry can really do is to expand the depth of the jobs within that industry and really highlight some of the occupations that young folks would be attracted to. For another example, we're working with the City of Houston, an initiative that they call Team Up. And so we are creating ways for young people in high school to learn about the sports industry without being an athlete. And so you can learn about sports media management. You can learn about contracts, about different roles as far as physical therapy, coaching. So, we are working to talk to and teach to an aspect of, you don't have to be the actual athlete. Let's get you to be, the president or president of operations, or looking at the general manager position, and figuring out in that example where industry can come in and how we could partner with local school districts, all the way from elementary school, middle school, and high school, to really highlight different aspects of industry versus maybe what they know of, and not have a depth of exploring what they haven't seen yet.
Yeah, so Dorian, you also have some experience working with United Way Thrive. Maybe you would talk a little bit about how that program creates linkages across some of the areas that have been discussed this morning, and maybe even a comment or two about mental and physical wellness.
That's perfect. So prior to my role here at Houston Galveston Area Council, I was working at United Way of Greater Houston, overseeing the workforce development aspects of United Way Thrive, which is United Way's family financial stability effort to engage nonprofit organizations around the concepts of job development, workforce readiness, and financial health. And so that is a network that we still work closely with through Workforce Solutions and our Workforce Connector initiative to engage nonprofit partners to really do the things that we cannot do. For instance, mental wellness, developing strong coping strategies for young people, developing a growth mindset, and working through United Way Thrive. We are able to work with organizations that can really go in and talk about what are good, healthy coping strategies. For instance, we can teach the essential skills piece, how to show up on time, workplace maturity, conflict resolution, but we don't teach those skills about what to do when you get frustrated. We don't teach deep breathing. We don't teach all of the clinical aspects that a mental health professional would be able to speak to as far as coping strategies and good decision making. We could talk about, all right, don't cuss out your supervisor, and show up on time, and forgive me if I, offend anybody, but don't smell like weed when you show up to work. We can speak to that, but we don't have the technical ability to talk about some of the mental issues that come from dealing with trauma and being in generational poverty. We don't have the clinicians on staff to talk about what it is that mentally a person has to go through as a teenager when you are a parenting teen, or you're a pregnant teen, or you are a young person that has been involved in the criminal justice system, or being through a foster care system, and all of the trauma that puts on a young person. And so United Way Thrive is an organization, is a program through United Way that has access to different nonprofit organizations. Our goal is to, help our young people get a job, keep a job, or get a better job. And, our region, we exist here in our region to make this the best place to do business, work, and live. That's Workforce Solutions. That's what we do. But as far as tapping into the other resources of a well-rounded, comprehensive approach and strategy, we definitely need community-based partners to come in and bring those tenets to address mental wellness and mental health from a perspective of helping young people cope, so we can teach them the skills they need to get a better job.
Thanks for that. John, we had a question in the chat, or a comment more basically, is And it makes a comment about the financial system and maybe the bias that's in the financial system and the limitations on it being able to serve Black and brown communities or Black communities. Could you speak a little bit to how you see the financial system helping Black communities?
Yeah, I'd be happy to. That perspective is quite true that over the years, a lot of the banking executives, presidents and CEOs of banks, and we would love to hire more minorities into the ranks of the executive positions. And so the excuse of the reason was true because there wasn't a large pool to pull from. This program that we developed at Texas Southern University will now be able to provide the access and the education to those students that will prepare and have opportunities to be in that industry. Now, the only way you're going to be able to make that better is that you got to have some folks, Don, that look exactly like the ones that are going to be in the communities they're serving. Now, I'm talking about minority groups such as African Americans and Latinos. What will happen is it's going to be a process, though. We're going to have the trained bankers that will go out now and communicate with those small businesses, as I indicated, and help them be able to understand the system and work directly with them. Otherwise, it's not going to happen. You are going to have to provide it, and I understood that. So the question is exactly right. How do we get more involved in it? Is by doing it ourselves and putting this program and this initiative together, and therefore it will work, I think, to bridge the gap that exists now of understanding and getting the financial services necessary. The only other thing is that what we'll be doing in addition to this initiative is not just the classrooms and education. We're going to be doing seminars to help educate what we call financial literacy and that type of thing, and to tell various groups about all of the programs that's going to be available to them so they can take advantage of those. So it's going to be an effort, but it's going to be an effort that's going to be a grassroots effort that's going to be supported by this very school called the Future Bankers Leadership Program.
Thanks, John. And to the person with the question, from where I sit at the Federal Reserve, we've seen progress in many ways, including with the Paycheck Protection Program that is out there to help small business and nonprofit. The round of PPP that's been in place over this cycle and the previous cycle, there were specific set-asides encouraging minority depository institutions and community development financial organizations that primarily reach low and moderate income communities. There were set-asides to ensure that funding was received. And it shows up in the numbers. You see much smaller loans that are coming through this cycle. And it's more because institutions like Unity Bank and others that are in the community have the set-aside tools to be able to support businesses within the community. Let me wrap it up with one final question for each of you. And John, maybe I'll start with you. In 60 seconds or less, how can schools, communities, business leaders partner with you in this effort? How can they reach out to you?
Yes, well, two things. One is I continue to tell you that this particular program called the Future Bankers Leadership Program is going to be the catalyst that I think will make all the difference in the world, because it's not going to just educate these future bankers, but what it's going to do is provide jobs for them. And what each person can do is reach out to me. I am over at the university as well now at the Jesse Jones School of Business, and reach out to me for any help or question that you might have. I'll be more than happy to work with you. And one last thing, we are going to be able to also be performing some seminars as well. And the last thing I would say, Don, you mentioned this regarding the PPP program. It's ready to start this third round coming up. And you can reach me at my position at Allegiance Bank, and I'll be happy to work with any businesses, small or large, that's out there that need some assistance on how to access that program.
All right, thank you for that. And Dorian, for folks that need the help from the Workforce Solutions, how do they get in contact with you?
I would recommend going to www.wrksolutions.com. My contact information is there. Also, we have our When I Grow Up curriculum that we provide from pre-K all the way through 12th grade that I would encourage any educators to look at and anybody at home to take to the dinner table with your child to talk about establishing a career pathway and talking about skills at a very, very young age. Also on that same website is information about youth and young adult services. So we could get young folks hooked up with internships, work experience, opportunities that we will pay for that young person. In addition to that, everything is on our website, www.wrksolutions.com. We will also work with CTE programs in high schools where we're able to work with high school teachers for externships with employers. And so teachers can actually go work with an employer, have an externship, feel what it is that they need to learn and go back and teach into the classroom when they're working with their students. And so they can just go to our website, and I just encourage them to just really research and figure out how our public workforce system here in the Gulf Coast region can support their work. But if anybody needs any direct contact or any triaging of any services or personnel, they can definitely reach me. I could put my email in the chat, but it's Dorian, DORIAN .Cockrell, COCKRELL at wrksolutions.net, and can just send me an email about any questions that they have and how our public workforce system can support. And Black youth, I'm not going to get on that soapbox right now, but personally to me, Black children are extremely important for the development, for the success, for our economic prosperity in this region. We have heard from a number of speakers how impactful Black people in general have been. I will say more so for our Black young people. It's critically important for us to wrap our hands on this issue so we can collectively raise the opportunity for our kids and our community.
All right, Dorian and John, thank you for a great discussion today, and I will turn it back over to Davika.
Thank you.
Thank you. I appreciate the panelists, and I appreciate the views on really the economic impact of education in our community, especially with Black children, Black youth. So the next phase of our program is it's going to be 3 presentations on the Black student experience. So our first presentation on the Black student experience comes from Dr. Amilcar Shabazz. Dr. Shabazz is a professor in the University of Massachusetts W.B. Du Bois Department of Afro-American Studies. His courses include the history of education of African Americans, reparations, and global Black studies. His book, Advancing Democracy, African Americans and the Struggle for Access and Equity in Higher Education in Texas, was the winner of the T.R. Fehrenbach Book Award and other scholarly recognitions. Some of you may know that Dr. Shabazz is the co-editor of the 40 Acres document, which he's currently, because he's still working, is still revising and amending that right now. He also has been staying busy working on a biography of Carter Wesley, the making of the Civil Rights Movement, and Juneteenth, the history of a day. And I'm looking forward to that, to Dr. Shabazz. I'll turn it over to you.
Thank you. Am I coming through okay?
Yeah, we see you loud and clear. Hear you and see you.
Very good then. I'm so glad to be here. Thanks and praises to all the organizers. I'll jump right into my talk, as well as is the kind of current model for this. Of all our studies, history is best qualified to reward our research. And when you see that you've got problems, all you have to do is examine the historic method used all over the world by others who have problems similar to yours. Those words are from Malcolm X in The Message to the Grassroots, and I use them in opening my remarks on this section on the Black student experience to say that in the short time we have here this afternoon to discuss education and the state of Black children, don't be afraid if I start 2 centuries ago when the first child of African descent was being raised in slavery for servitude to an Anglo-Texan white supremacist settler colonial regime as part of the system of racial capitalism. Notably, right here in the host state of this summit, the state of Texas, which wasn't a state then. The name of this child, this African child, comes to us in the historical record in 3 different forms: Kiamata, Kian, or simply Ki, and was enslaved by a woman named Jane Herbert Wilkinson Long, born herself in 1798, died in 1880, and she regarded herself, and for a long time in the history of this state, was regarded as the so-called mother of Texas. She gave birth to her 3rd child in Texas on Bolivar Peninsula on December 21, 1821. Accompanying her and helping her give birth to this child was Kian. And this is what comes down to us in the historical record, is all we know, as what historians can tell us about Kian. Kian, the date of her birth, unknown, probably in the year of 1807. The date of her death, unknown. And I'm reading from the Texas State Historical Association Handbook of Texas History now. Kian, a Black slave girl, was the property of Jane Long. She remained with her mistress on Galveston Island in the winter of 1821 to 1822, secured food for her, and aided in the care of the Long baby born on the island. In 1822, she accompanied Long to the mainland and eventually to the areas of present Harris County, San Felipe, Brazoria, and Richmond. Kian was mortgaged to General Long and eventually delivered with an option to repurchase to a new owner. Leonard Peck helped Long to redeem her sometime later, after which she stayed with the family until her death. Long allowed her to marry, and she had 4 children. The descendants of Kian were living in Richmond in 1900. End quote. So the first Black child in the recorded history of Texas was property. She worked without pay. She is cut off from her parents, any siblings or kinfolk she may have had. She was a thing that could be mortgaged. She could not leave Jane Long. She was allowed to breed like a dog or a horse, her 4 children becoming the property of her owner, and so the cycle continued. That's what we know about the first Black child that grew up in what would become the state of Texas. Recently, an historical researcher noted that Kian and her children were, quote, granted their freedom following the Civil War. Well, not much choice there, if we recall the Juneteenth field order of Major General Gordon Granger issued in Galveston, which made it clear that the slavery days were over. But this research shows that one of Kian's daughters, Clarissa, had a son, Henry Breed, who became one of the city of Houston's first African-American policemen. Now I want to jump from or use this story of Kiamata to situate the problems and the issues that face us that we can observe through history in regards to the education of Black children. And we know that the larger context of the country under Thomas Jefferson, he articulated the inseparable relationships between popular education, education of the people, and a free society. If a nation expected to be ignorant and free, he argued, it expected the impossible. To the legislature of Virginia in 1787, Jefferson proposed a popular educational system that would offer 3 years of public schooling to every white child of the Commonwealth of Virginia, and then send the brightest male youngsters on to grammar school and college at public expense. But as James Anderson writes in the most important book, and I'm going to recommend 2 books for you as reading material if you don't know them, The Education of Blacks in the South, 1860 to 1935, James D. Anderson, one of our brilliant scholars at the University of Illinois. He says, but what of the enslaved children who constituted about 40% of Virginia's children, and who along with enslaved adults formed the basis of wealth for Jefferson as well as for the state of Virginia? It was believed that Virginia's peace, prosperity, and civilization depended as much, if not more, on the containment and repression of literate culture among its enslaved population as it did on the diffusion of literate culture among its free population. Let me move quickly from there to point out that between 1800 and 1835, most of the southern states enacted legislation making it a crime to teach enslaved children to read or write. Texas, interestingly, was not one, but again, it's not a state until 1845. It's in its period as a nation, 1836 to 1845. It did not particularly promulgate many laws concerning Africans, but it did ban free Blacks from the state. And that's one of the really important triggers in prompting the bans on education. It was the Nat Turner Rebellion. It was Gabriel Prosser's revolt conspiracy. It was these actions, many of them involving free Blacks who were literate, that are going to be the triggers of these repressive laws. Other than that, there was no need to regulate slaveholders in regards to allowing literacy or educating, because they're not going to do anything that's going to threaten the ownership of this property. Jumping ahead to say this, that from all this context of slavery, as we have the Juneteenth Declaration of Freedom, as we move to a new situation, we know we had the early period under the Freedmen's Bureau, the attempt to establish a true education for African children. That is very brief. By the time the troops are pulled out in 1877, the education of Blacks in southern states fall back into the hands of the former slaveholders, of the plantation owners, the planter aristocracy. And for the most part, they are not in favor of much education, even though it's progressively becoming the law of the land. The group that really intervenes, and I cover this in the second reading material I recommend to you, and that is my book, Advancing Democracy, African Americans and the Struggle for Access and Equity in Higher Education in Texas. And the main group, and I cover them in chapter 1, that really organizes on the question of Black education, one of the key groups is what is known as the Teachers State Association of Texas. They would often have to put the C on the front for colored, the Colored Teachers State Association of Texas, because the Texas state, the Teachers State Association of Texas, TS, that was for whites only. They set up and did not allow Blacks in. Blacks set up their own in 1884. It was a dozen men that established it, headed by the then head of Prairie View today's Prairie View A&M, a man named L.C. Anderson. But it also involved others. And of course, after 1884, going into the 1900s, education is the teaching force will feminize dramatically. It will be less and less an occupation of men and more of an occupation of women. And as that occurs, women will be an active and vibrant part of the leadership and of the rank and file of the Colored Teachers State Association of Texas. The credo of the organization was best in education for every Negro child, best working conditions for every Negro teacher. In 1900, the members of this organization debated the industrial education model, the so-called Hampton-Tuskegee model that was trumpeted by Booker T. Washington. They debated it, and their conclusion, one of the committees reporting on it, said that the idea that Black minds were best suited for practical training was unjust, illogical, spurious, and antagonistic to American peace and prosperity, and entirely out of step with the soundest philosophy of the age. So this notion that Black minds were only able to handle manual training, of being trained for domestic service or for agricultural service, and not for the liberal arts curriculum, not of being able to go on to graduate high school and even think about going to college. That was a spurious idea. They rejected it, and that was in 1900, at the height of this model being dominant throughout the United States, being backed by all of the big industrialists, Carnegie Mellon, John Rockefeller, you go down the list, William Baldwin, Sears and Roebuck, all of those, the wealthy, all supported this industrial ed model, but in 1900, these teachers are opposing it. In we don't really see change in the dominance of that model until the 1930s. And signaling that change is a great professor of sociology at Prairie View A&M, Henry Allen Bullock, who began organizing these conferences on the state of what we could call, similar to this summit. He would start organizing these summits every year. And the very first one concerned a survey of the education of Negroes in Texas. But the eighth one in 1937 was particularly poignant. He brought together all kinds of leaders to look at the issue of that one being entitled The Availability of Education for Negroes in Texas. And speaking for the Colored Teachers State Association, the president, I.Q. Hurdle, when his came to speak, he reminded folks of the credo, the best in education for every Negro child. And he stated a basic principle of their philosophy is, quote, that the teacher who does not love people is a failure in the beginning. They emphasize that we must love Black children. How did one of the speakers earlier say, in quoting one of the founders of Black Lives Matter, little Black lives matter too. That has to be a mantra, not just in regards to the infant mortality gap or opposing abortion, but it needs to be our mantra in Black education, and it must be predicated on a philosophy of love. We can learn this from the Teachers State Association, going back to their beginnings in 1884 and in their whole philosophy. Finally, there's a lot more I could say, but I want to yield the mic. I just would want to address finally that the point that was raised about reparations. Reparations is the framework that we need to put all of our concerns about disparity and inequity, that it's about repairing the harm that has been done, closing the wealth gaps, closing the infant mortality or the survival rate gaps, all of these health gaps that concern our children, that it's predicated upon us beginning to think less as this minority group, and trying to assimilate and fit in. And we need to go back to the unfulfilled promise of 1865, of 1866, that we never received the closure, the efforts to end this systemic harm. And it just continued after 1860, after the 1860s, and certainly after the troops were removed in 1876, 1877. So if we understand this intergenerational trauma effect, we must realize that in our roles as teachers, as practitioners, as social workers, as people out there trying to do good by Black children, trying to advocate for them, that HR 40, S40 in the Congress is a basic demand we must all rally around. Representative Sheila Jackson Lee, and I mean no hyperbole here, is the Martin Luther King of today. She is the Ella Baker of today. In bringing this bill, and in fighting for this bill that has with her has 170 sponsors in the Congress, only needs a little over 200 to pass. We've got to get Speaker Pelosi to bring this to the floor, vote this forward, and then Cory Booker's bill in the Senate. If we have to bring it through reconciliation and bring it down to the same vote as the $1.9 trillion COVID relief bill, let's do it. Because mind you, all of the opposition that's saying that, oh, I don't want a handout, I want a hand up, this is just a handout, all of that is irrelevant to this question. The bill calls for the establishment of a commission that studies the harm that was done through the years of slavery, and looks at studies how it continued by our failure to never do reparations, do the repair work, and where we are today in terms of recommending certain remedies. It doesn't say anything about what the paper amount might be.
Right, and that's the point, right, Dr. Shabazz?
Thank you.
Right, yeah, Dr. Shabazz, is really about reparations is not money. Reparations is making good on the deficits that were created not by the people who had to suffer the deficit. So thank you so much for your passion and for your commitment. The Black student experience can be better if we really look at it through that lens. We'll continue with this part of our presentation and have Dr. Fred Bonner II speak to us about the Black student experience. He's a professor and endowed chair in educational leadership and counseling at, Dr. Shabazz talked about it, Prairie View A&M. He earned his BA in chemistry from the University of North Texas and a master's in education and curriculum and instruction from Baylor University. Dr. Bonner, I'll hand it over to you.
Okay, thank you so much. Can you hear me okay?
Yes, we hear you and we see you.
Okay, excellent. So I just want to thank the organizers for inviting me, Ms. Bondage, and I really appreciate the opportunity to talk about my research and to talk about issues that are important to me. The focus of my work has been on academically gifted African-American males. So one of the things that I have attempted to do with my research agenda is to move the needle and tell a very different narrative. So all of the narratives very early on, particularly when they talked about Black males, they came from what we call a deficit perspective. The deficit perspective is that Black males are not successful. They're not doing well. They're not achieving. However, I decided very early on with my work and my research to launch my research trajectory to look at Black males who were doing well, or what we call an asset model. So if we look at the slides here, if we just go back one slide. Okay, sorry. Well, thank you. Again, so this particular slide, you see this collage. And one of the things that I do when I'm out consulting with school districts, when I'm working with institutions of higher education, many times I'm working with individuals who are launching Black male initiatives, or they just want to know, what do we do to improve the success and the conditions for our Black males in schools? So I start with this picture collage, and my question is, who is gifted? Again, the background of my work is focused on academically gifted. So I want to know, what are their perceptions? What do you know? Looking at this collage, who's gifted here? So as you take a look, you can imagine I get a range of different responses from, oh, absolutely. The guy at the bottom in the middle, the doctor, sure, he's gifted, he's a doctor. The guys in the upper right corner, oh, it looks like they're part of some academy. They're very well dressed. Sure, they're gifted. But then it shifts from that to, well, the brother in the corner on the far left, well, I don't know so much. So the brother is sagging, no shirt on. So, and all of that goes into this whole notion of phenotypes. We think we know what giftedness looks like. And most of the time we get it wrong, even with white students. But you could imagine how wrong we get it when we look at Black males. So my work is aimed at moving past phenotypes and moving past perceptions and stereotypes into getting to the real about the academic potential that all of these brothers have. And eventually what I like to get folks to in looking at this collage is that all of these brothers have giftedness and potential to be gifted. Next slide. Most of the work that I do, I look at research from a lot of different perspectives. One of my main go-to sources is the SHOT report, SCHOTT. The SHOT Foundation, they put out a report every 3 to 5 years, and the report gives a rendering of how Black males are doing across the country. And they use the NAEP data, National Assessment of Education Progress. And this data gives a rendering of Black male literacy, and it gives a rendering of how they're doing in mathematics and scientific areas. And as you can see, as we look across the country, we have some pretty severe problems. If we look at the graduation rates in some of the states, below 50%, some between 50 and 59%, all the way up to graduation rates of 70% and above. But what we see is that in those states with the 70% and above, there's not a high population of Black males. So this schematic gives us a blow-by-blow account of how Black males are doing. And we know from the literature that there's an over-inclusion of Black males in this country in special education and an under-inclusion of Black males in gifted and talented education. So I would encourage all of you to check out the SHOT Foundation report. If you go to their website, all their information is free. Next slide. Here's just a very short snippet of some of the research that I've conducted, that I pulled together. If you take a peek at that second bullet point, we see that only 59% of Black males are graduating from high school. And one of my colleagues said that for any other population in this country, we would have declared a state of emergency. Why are we not for Black males? And we see here, we know a lot about that whole notion of the Black males being pushed out of school into the school to prison pipeline because they are not achieving and not excelling within the school system. So they're being pushed into the prison pipeline, I should say. Next slide. The SHOT report, more critical information. One of the sub-reports with the SHOT Foundation is this one. It's called Invisible Men. And with this report, it gives you an idea of how Black and Latino males are doing in the country. And we see from this report that we have better tracking of Black males who have been incarcerated than Black males who are graduating from our high schools each year. And they go on to give 3 different reasons for invisibility. But basically, the overall message here is that many times we overlook Black males because in our school and school systems, their attendant problems, their challenges, and even their successes at times they just go invisible, unnoticed. Next slide. This is my book. Most of my work is based on this book that came out a couple of years ago. It's called Building on Resilience. And what I attempted to do is I wanted to have a compendium where folks who are engaging in Black male programming, who were doing rites of passage programs, who were trying to create a success pipeline for Black males. I wanted them to be able to go to the shelf to pull off a book, and in one compendium, they would have all of the information that they needed about how to successfully structure and have a theoretical and conceptual framework for what they did by way of Black males. Next slide. Here is all of my work has basically coalesced into this model. And this model has been used with all of my grant and funding initiatives. And it is kind of like a rendering of all of my work and all of my research to date. And it comes to bear in this model that I've termed the AGBME model, academically gifted Black male engagement model. And basically what this model shows is that these are the factors that I have identified that assist Black males in being retained and persisting in institutions of higher education, whether that's an HBCU or a PWI. So we see the factors at the core of all this is, what is the institutional environment? What is the environmental context that we're creating? And other factors, you know, self-perception, choice, relationships with faculty, peer relationships, and family influence and support. Next slide. I think that is it. And I appreciate you tuning in.
Thank you. Yeah, and I don't know if there's any questions in the Q&A, but Dr. Bonner, really appreciate the research that you're doing, because I do think one of the keys to the Black student experience is the Black male student experience. I think Dr. Quinn earlier talked about, you know, the Black female problem, the adultification of Black females. I think the issue with Black males often is that, right? The presumption that a certain haircut, a certain style also is somehow an indication of their lack of ability or lack of academic, right? And I say this because I have a brother who looks like one of those pictures, but has a higher IQ than I do, right? So thank you so much, Dr. Bonner. We appreciate you being here.
I'm glad you said that, because I said years and years ago that I wanted to paint a picture of that brother who was sitting in your classroom, who came from that side of the tracks that had all of those attendant problems, but he's sitting in your classroom with a 99.9 average. We need to understand what he is doing. That's right. I'm with you. I am on that. So I think this has been a great conversation. Started with Dr. Emil Shabazz talking about, Emil Shabazz talking about, you know, how we really, reparations are important. Now talking to you about Black male students. I think ending our conversation with Dr. Kimberly McLeod is perfect. So let's move to our next presentation on the Black student experience. And for those of you guys who do not know Dr. McLeod, I'll give a brief introduction. So Dr. McLeod is the Dean of the College of Education and Human Services at Texas A&M University Commerce. She spent her entire professional career in public education. She is, just quickly, I'll tell you, she's written a lot. She's written 8 academic books, 3 children's books, and over 12 articles in national peer-reviewed journals. So she's also, I'm gonna throw this in here, a mom of 3 high school boys, Major, Mitchell, and Micah. So kudos to you. I will hand it over to you, Dr. McLeod.
All right, thank you. I am trying to share my screen. Let's see if I can get it to work. There we go.
There we go.
All right, good afternoon, everyone. Thank you for the introduction, Davika. I have to say, you look exactly like my younger sister who used to teach at Prairie View. I'm looking at you and I'm just so excited because I'm like, oh, I keep thinking, is that my sister? But anyway, I want to talk to you guys about the Black student experience from a social, emotional, and intellectual perspective. There's a reason why so many of these presentations today have started not with where we are today, but where we have been and what the Black experience has been like to get us to this point. And so while I won't repeat what you've already heard, there is one point in the Black student experience that I do want to highlight from slavery, when we weren't allowed to learn. And if we were caught trying to learn, there was severe punishment to, okay, now you can learn, but you can learn over here, you can't learn over here. It's going to be segregated, different learning experiences, different learning institutions, supplies, and materials, where you start to see inequity institutionalized, where racism is institutionalized. It is a normal part of the system, to where Thurgood Marshall fought for Brown versus Board of Education. And without going into the details in that case, because I do not have the time, there is one cornerstone in his argument that really helped cement that case, and that was the doll study. On the 50th anniversary of Brown versus Board of Education, there was an 18-year-old girl out of Atlanta that wanted to see how far we've come since Brown versus Board of Education. I want you to see the Black student experience, the impact of institutionalized inequity, the impact that it has on social, emotional, intellectual, outcomes for our students. And then briefly, I'll talk about possible solutions and where we go from there.
In Brown versus Board of Education, the famous case that desegregated schools in the 1950s, Dr. Kenneth Clark conducted a doll test with Black children. He asked them to choose between a black doll and a white doll. In most instances, the majority of the children preferred the white doll. I decided to reconduct this test as Dr. Clark did to see how we've progressed since then. Can you show me the doll that you like best or that you'd like to play with?
This one. I like that one.
Okay.
This one.
That one?
I like to play with this.
And can you show me the doll that is the nice doll? Why is that the nice doll? And can you show me the doll that looks bad? Okay. And can you give, and why does that look bad?
Because it's black.
And why do you think that's a nice doll?
Because she's white.
And can you give me the doll that looks like you? "15 out of the 21 children preferred the white doll."
But the question is, why? Why are they choosing the white doll? And I have 3 boys, as she said, and I just cannot believe that anyone taught anyone in this children, any of the children in this video or my boys, that, you know what, black is bad, white is good. Black is ugly, white is pretty. Black is dumb, white is smart. No one directly taught that to those children, and they weren't born knowing that, but somehow they were able to identify good and bad by the color of the doll's skin, and that was a learned behavior. It was taught through institutionalized systems of inequity. It was taught and learned not only in the schoolhouse, but on the pathway from leaving the house to get to school and to get back. It was in the entire community. But the impact of the institutionalized inequity on the African-American learner is we are taught to hate the skin we are in. We are taught to hate our look. We are taught to hate our hair. All of those are learned behaviors. Children aren't born knowing how to hate themselves or how to hate anyone else. All of that is learned. But if you think about the history of African-American education and the African-American experience within the community and society, and you're riddled with images like this, not only from early years, but you'll see images like this in other parts of the world. You'll see it subliminally. You will see still African Americans portrayed as eating watermelon and chicken and clowning and not having a real value and impact and contribution to the African American experience in the classroom or outside of it. James Baldwin says it like this.
What is relevant about this is that whereas 40 years ago when I was born, the question of having to deal with what is unspoken by the subjugated, what is never said to the master, of having to deal with this reality was a very remote possibility. It was in no one's mind. When I was growing up, I was taught in American history books that Africa had no history, and neither did I. That I was a savage, about whom the less said the better, who had been saved by Europe and brought to America. And of course, I believed it. I didn't have much choice. Those are the only books there were. Everyone else seemed to agree. If you walk out of Harlem, ride out of Harlem, downtown, the world agrees. What you see is much bigger, cleaner, whiter, richer, safer than where you are They collect the garbage. People obviously can pay their life insurance. The children look happy, say, you're not. And you go back home. And it would seem then, of course, that it's an act of God, that this is true, that you belong where white people have put you.
Part of deinstitutionalizing the inequities that are in our education system begins with reteaching and unpacking the dysfunctional aspects of what is in our curriculum and in our everyday life, and replacing that. If children can be taught to love, to hate, they can also be taught to love. But it's not only important for us to do that, for our students to teach them how to love themselves, how to embrace themselves, how to see themselves beyond the image that someone else has painted of them and for them, to know what it means to understand as opposed to affirm what they have been told. What that means, what it looks like if we do not begin to, with intention, deinstitutionalize inequities in the school system, it will continue to look like what it has looked like from the beginning of time. And what you see now, without going through a barrage of numbers, you see an over-identification of African-American males in special education coded as emotionally disturbed because they ought to be angry with somebody trying to put them into a box that they do not fit, because they want to be seen as the good doll, the pretty doll, the doll that has value and input and significance, and they are fighting to break through this image that has been placed upon them. And what I'm saying is this: when you are taught to hate yourself, you just don't hate the skin. Malcolm X says you can't hate the roots of the tree without hating the whole tree. They won't only hate themselves, they'll hate anything that looks like them. But not only have students of African descent been taught to hate themselves, get this, with systems that institutionalized have practiced inequity and not have addressed it. Those that are teaching and leading those students do not have that same respect as well. Baldwin says a child cannot be taught by anyone who despises him, and a child cannot afford to be fooled. We have to not only educate and liberate the potential of our students, we have to do that for our teachers that are in those classrooms and the building leaders that are leading the teachers in those classrooms to create this idea of freedom. And I'm getting ready to close. 4 areas that I think we need to address. We need to begin to create our own freedoms of community. You saw his history has already taught this through freedom schools and through the 60s. And we need to unlearn what we have been taught and then reteach an affirmation curriculum that affirms the value, the contribution, the significance, and the worth of every child. Every child, especially those that are of African American descent. We have to teach our children to embrace and love the skin that they're in. And lastly, and I will begin to close on this, we have to teach them how to tell their own story. Malcolm X says, if you're not careful, the newspapers will have you hating the people who are being oppressed and loving the people who are doing the oppressing. There's a quote, it's an African proverb, and this is my last slide. And it says, until lions have their historians, until lions have their own historians, tales of the hunt shall always glorify the hunter. Until our students' voices can be heard and understood and their needs not masked and focused on things that are beyond them, until our students can tell their own story, their own experiences, see their value and worth in the curriculum, the story of the hunt will glorify the system and not the students in the system. We have to begin to tell our own story, empower our students, our parents, our teachers, and our leaders to deinstitutionalize inequities and racism in the system. My name is Kimberly McLeod, the Dean for Texas A&M University Commerce. Thank you, and I will turn it back over to Davika.
Thank you so much, Dr. McLeod. Really appreciate that entire segment on the student experience. There has been a lot today, and we still haven't even had our keynote yet. So I'm actually going to hand it over to Donald Bowers to introduce our keynote speaker. Donald?
Thanks, Davika. It is definitely an honor and a privilege to introduce today's keynote speaker. To say she is a force of influence as an educator and on the subject of how institutions and communities understand and respond to issues regarding racial injustice would understate her impact. From the creation of the Brown University Steering Committee on Slavery and Justice, the Ruth Simmons Center for Race and Justice at Prairie View A&M, where she is currently president, to even serving as co-chair of the Greater Houston Partnership's One Houston Together Racial Equity Committee, Ruth Simmons is definitely a thought leader's thought leader. I refer you to her bio in the program for additional details on her education, background, and accomplishments. But I have to take a point of personal privilege that I get an opportunity to visit with her approximately once a month as a member of our Federal Reserve Bank Board of Directors. And I am always taking away from those conversations great nuggets of things to accomplish and work on from my perspective. So Dr. Simmons, thank you for sharing your keynote remarks today, which I hope will include reflections on your personal story, in addition to bridging some of the topics we discussed today on improving the overall well-being of Black children. Dr. Simmons.
Thank you, Don, and greetings to everybody who is participating in this conference. I must say that the last session was very moving to me, and I appreciate greatly the contributions that each of the presenters made in what is a long and troubling history with regard to how our children have been treated in this country. I want to say good afternoon to the sponsors of the program and to Dr. Sanborn and Skaggs, as well as other presenters. I bring you greetings from our 144-year-old university, a university created in inauspicious times under the weight of slavery and Reconstruction. Established to provide opportunities to freed slaves and, on the one hand, to prevent them from seeking equal access to the opportunities afforded whites, the normal school that became Prairie View A&M University gave Blacks in that and succeeding generations the opportunity to mine their capabilities and advance the well-being of their families and communities through learning. Now, almost a century and a half later, institutions and organizations such as the ones that are represented by those participating in this conference are still engaged in making opportunity possible for millions who struggle on the margins of society. The opportunities that your efforts afford children may be the single most important means they have to access the full array of benefits of freedom and equality. All of you who work with programs providing an array of assistance to young people must know and appreciate that the work you do prevents our country from reinforcing policies and approaches that have held so many back across time. In what ways? Lack of economic means, disparities in health and education, the lack of a full range of employment opportunities, the persistence of bias and racism, and unfortunately, societal indifference to the plight of the neediest. I hope you absorb the fact that your work, and by extension, you, are vital to making our democracy healthier, enabling the broad swath of citizens to participate fully in their communities. In the history of the pursuit of equal and fair access advocates have typically and appropriately set high expectations for young people, demonstrating an eternal truth that exceptional achievement is the consequence not of low expectations, not of modest effort, but of impassioned and sustained attempts to mine the wellspring of knowledge and talent God has granted human beings. Those of us who dedicate our efforts to improving outcomes for children of all backgrounds keep our focus on the far horizon, expecting that change is inevitable and that those we seek to help will ultimately enjoy the full benefits of equality. Animated by a mission that requires reservoirs of energy and enduring standards of achievement, we hold up for those who may not yet be able to imagine a brighter future, shining examples of what is possible. This constant stoking of hope is the essence of successful attempts to exploit the fearsome potential of the underserved. I was taken especially with the enthusiasm in the voices of some of the presenters. I always say, especially to teachers, if you walk into a classroom and you're feeling down, you better learn to be an actor, because you don't walk in front of children in any frame of mind other than the most enthusiastic and hopeful frame of mind. I suppose we will never understand fully why we as a species have succeeded so well in exploiting the immense advantages of evolution, conquering the threat of extinction through the exploitation of extraordinary physical, social, and intellectual powers. But we have survived through successive periods of immense challenges while advancing ever more important technological and scientific discoveries. Because of these widespread advances, the young people we serve today face a future still ripe with promise. They stand on the brink of the most daring and most important advances yet seen, as the breathtaking acceleration of scientific, technological, and medical discoveries stand to improve the quality and longevity of life. But the question is whether, through the enhancement of our many interventions and policy advocacy, the youth we serve will be able to enjoy these benefits to the same or a similar degree. I know we are enduring right now a time in which one can easily be discouraged about the potential for those we represent to enjoy fully the promise of the Constitution. We are in a period where some would like to roll back the gains attained through civil rights activism. They say enough is enough, and organize aggressively to overturn laws and precedents, to block full and equal participation in governance, to block access to equal education, and to push for a return to the shameless denigration and racism of past eras. For me, this period is reminiscent of strategies I saw dominating my world as a child. I was born on a plantation in East Texas, where my parents were sharecroppers. Not only were they field laborers, but every child in our family of 12 was destined to be the same. There's no concern for child labor, no concern for lack of regular access to schooling, no concern for the limited nutrition and lack of basic medical care. We existed on the margin of society, hopeful always for a better day. Though not able to be schooled formally on a regular basis, we were very knowledgeable, though, about the long list of taboos pertaining to our status as Blacks. Growing up in the 50s and 60s, I understood well from my earliest age that my life would be governed not by what I could do, but what I could not do. I could not associate with or aspire to be equal to whites. All signs literal signs pointed to the fact that I was relegated to separate treatment and facilities and inferior resources. I couldn't hold certain jobs because of my gender and color. After all, my limited intelligence would prohibit my aspiring to be any but menial labor. I certainly couldn't go to college. There were few available for Blacks, and cost was prohibitive. I could not speak up or speak out without fear of brutal subjugation. While slavery was legally behind us, we remain enslaved by organized efforts that prevent us from believing in our human worth. Internalizing the admonitions to stay in our places, we lost many to hopelessness and despair. So how is one to find a reason to believe that the future could be different? Fortunately, as children, we found hope in our many advocates, men and women who looked to the far horizon and, in spite of evidence to the contrary, believed that change in our status would eventually be made possible. So what did they do? They gathered us up. They preached to us about change. They pushed us to work ever harder and wrapped their arms around us to make certain we knew that they respected, valued, and cared for us. There is no better formula for the defeat of hopelessness than for those who hold the responsibility for the underserved to hold aloft a vision of what can be. My teachers did that for me. Growing up in a household where college readiness was not a goal, I didn't think of myself as one who would be eligible for college study. My parents had an 8th grade education, and though they loved and cared for us, they no doubt expected me to do as my mother and sisters before me had done, and that is become a maid. Well, this was honorable work, to be sure, because watching my mother toil instilled in me the greatest respect for honest effort and a commitment to work as hard as she did. But my teachers had other ideas. Ruth, they said, you're smart and you could go to college. Well, this didn't seem at all likely, but because they cared and insisted, I worked hard in my 5th Ward high school, graduating number 2 in my class. So what brought me to that point? A host of programs to help students like me who lack the resources to have the broadest or strongest education. After-school programs, a vibrant community center with a library. Today, I recognize that those programs and the advantages they offered placed me in a position to compete. And without them, I would not have been able to excel to the same degree. Who were the protagonists of the effort to ensure a better future for me and so many others that I knew? First of all, a completely dynamic speech coach who got me involved in debate, producing verbal ability that would help me to the top of my classes in the future. There's one thing about it, even whenever I faced the most trenchant bigotry, I knew that I could respond with my mouth. And that got me into trouble, it's true, but it also saved me because I always knew that I would be able to answer anything. There was also a summer math camp that gave me a sense of what college was like, a community center that afforded me music lessons, myriad extracurricular activities that gave me the opportunity to understand how I might find my way as a leader. And most of all, caring and engaged teachers, activists, facilitators who kept their eyes firmly on the horizon, never discouraged by the obstacles of that era. I often admit that I had frequent thoughts of dropping out of college, but I simply could not bring myself to give up because of the army of people standing behind me, making it possible for me to succeed. And I would have felt terrible to give up when so many were trying so hard for me. So that's what your efforts mean to the young people that you're helping. Seeing you striving for them often prevents them from giving up. So that is what I hope all of you involved in the many programs you represent here today will do for today's children as they weather one of the most challenging times in recent history. Like those who helped me overcome the rampant discrimination of the 50s and 60s, those who work in your programs have a daunting challenge. Not only is the world in the throes of myriad economic, health, religious, and economic trials, but our country has been in the throes of renewed civil turmoil, exposing the frayed hopes of many who had believed that full freedom and equality were finally at hand. You must do your work in the face of a seemingly intractable dilemma, that of humans finding it so difficult to accept and respect others in the simple interest of their common humanity. Unfortunately, we differentiate based on the tastes that we acquire from the time of birth, tastes that are mightily influenced by narrow self-interest. We learn to exclude or validate others based on a narrow set of personal experiences and preferences. We show contempt for those who are not educated, who are different, who live in poor communities, who are without means. General indifference to such circumstances makes our work more challenging, but those who benefit from what you do can see in stark relief the value of what you are doing. As racial tensions in our nation repeatedly flare up, one can't help but be struck by the elegance and breadth of vision manifested by the civil rights struggle of the 60s. Articulated powerfully and prophetically by Martin Luther King Jr., his vision of a beloved community was powerful not merely because it was probing and capacious, including everybody, but because it exposed the doubts and uncertainties that necessarily accompany any striving for good. Martin Luther King Jr. was a wonderful embodiment of the vision of a unified nation. His faith reassured us. His seriousness of purpose persuaded us. His inclusive vision lifted the nation beyond a sordid history of discrimination. His beloved community was more than a concept. It was really a calling. As we facilitate the learning and advancement of new generations for whom MLK is a distant figure, how do we make manifest the kind of hope he engendered, the kind of elegance of vision he manifested, the kind of pride he instilled in working toward not only ongoing self-improvement, but also the transformation of society into one where everyone mattered. I didn't have much of a sense of this until I was camping in Spain during my Fulbright year, when somebody walked into my tent one morning and said, Ils l'ont tué. Ils ont tué Martin Luther King. When I heard that, I thought it was a joke, of course, when they said that he had been killed. Wanting to see if it was really true, I went into the town square nearby, and I observed something that has never, the image of which has never left me, and that is in Spain, northern Spain, in a tiny town, people standing in the square, weeping, reading newspapers about the death of Martin Luther King. Such was his reach because he spoke of that beloved community, encompassing everyone. Following George Floyd's death, I began to think about this in regard to my own students. How must they be viewing the world at this moment? What are we to do in a post-COVID world in which searing racism and trenchant disparities have been laid bare? My first thought was that as educators, we must be at once purveyors of hope and speakers of truth. Learning should, at its very best, help us to cope with reality as we face it, and not as we would want it to be, while keeping our eye on the horizon and encouraging hopefulness in our students is the sober duty of everyone who is charged with the future of young people. Our students will press us to know what is real and what is illusion. And well, they should. A commitment to a fulsome representation of what is at stake is a necessity, and we must commit to honesty in doing our work. At the same time, we are invariably modeling for them how they must similarly engage with the task of finding new solutions to age-old problems. We are demonstrating how they must care about their fellow citizens. We are showing them their duty to carry on the work of democratizing the nation. For well over 300 years in this nation, formal educational curricula have promoted values intimately tied to implicit assertions of racial and cultural superiority. When we speak of systemic bias, we must understand how deeply entrenched that bias is and how it has affected what and how students learn. Our students have understood and exposed the need to question the values long associated with learning achievement and intellectual capacity. They not only question the basis of the meritocratic ideal, but they also challenge the iconography that reifies and upholds ideals and values based on racial and ethnic bias. We who are charged with assisting youth in advancing must not be associated with the taint of untruthfulness. The best way forward, I think, is to be open about our history, to embrace questions about the truthfulness of that history, and to work with students to understand in the context of that history how to go forward in the most positive vein. When I became president of Brown University, I undertook to open a review of the university's history with respect to our founders' entanglement with slavery. The mere fact of seeking the truth about our history was initially quite painful for many. But we demonstrated in the end how vital truth telling is to young people and to old people too. Encourage students to understand their histories, to find their unique voices, and to think about ways in which they can contribute positively to the future of society by living out that truth. I don't think there's anything more powerful than truth, I have to say. I remember being on the Princeton campus when students were demonstrating against Woodrow Wilson. I was there to speak in an unrelated area. The students called me into the president's office, which they had occupied, and they asked me for my thoughts about their list of demands. And they had a very long list of demands. I looked at it, and they had some worthwhile things on their list, to be sure. But they had one that stood out, and that is they insisted the university must tell the truth about Woodrow Wilson. So I said to them that there would be lots of different opinions about their list of demands, but there was one that was absolutely unimpeachable. And if they held that high, they could not lose. There's no doubt that the university had to tell the truth about Woodrow Wilson, and that's what the students achieved. I was very proud of them. I refer to the assistance that I received from so many people when I was a child, assistance that made possible my journey as the daughter of sharecroppers and laborers in the midst of segregation, all the way to the helm of an Ivy League university. I spoke of the many counselors, teachers, advisors, and social programs that made that journey possible. I just want to mention, too, that my parents gave me something that was invaluable, and that is I'm timing myself. And that is the ability to understand my worth as a human being and some respect from my origins. Healthy families produce confident, caring children who can make their way in the world. So our task is to support those families and allow them to nurture children, giving them self-confidence and the ability to walk about the world with their full presence. My education gave me the ability to see how my life is tied to that of others. We have to keep children enrolled and advancing in their education, exposing them to the diversity of the human species. I was given access to higher education, which gave me the knowledge to develop my particular truth into a pathway for leadership. All of these things obviously helped me get to the place where I could be confident as a leader. Many of the young people you serve will not be deterred by the present circumstances, not by COVID-19, not by the economic crisis, not by the digital divide, and not even by the delay of justice under the law. They will seek and exploit the opportunities you put on their path because you are there helping them block and tackle. They will overturn obstacles at each turn because you are hopeful, persistent, and caring. And most of all, because you look to the horizon, showing them that conditions can improve. So I'm here to thank you for the work that you do. Thank you for being ever hopeful about the future of our children. You are making a way in ways you can't imagine and that you may never fully understand. I often think about all of the people who never, ever understood how much they helped me as a child. And while you always wish you could go back and find them all and tell them what it meant, it's impossible to do. But the slightest nudge, the slightest caring act can have a profound influence on a person's life. And that's what you're all doing. So thank you for that.
Thank you, Dr. Simmons. I really appreciate your words, the charge, the thanks. And what I took away most was when you said that for you, they held aloft a vision of what can be. And I think that's really what this is about, right? We're looking at the state of Black children today, but it really is about holding aloft a vision of what we can be, what our Black children in Texas can be. So thank you so much. I'm going to give a round of applause. I'm the only one here, but round of applause in the chat as well. Thank you so much. So moving now to our next portion of our program, we're going to have a short video by Texas Senator Roy West. Many of you guys know Texas Senator Roy West, but I'll give a brief overview. He's been in the Texas Senate since November 1992. Since he's taken office, he's represented the 23rd Senatorial District, which is in Dallas County. During his tenure, he's done many things. Two quick highlights, though. He has been named to Texas Monthly as one of the 25 most powerful people in Texas politics. He's also been on the Associated Press Movers and Shakers list and has helped increase funding for at-risk youth, awarded greater compensation to victims of violent crime. And Dr. Simmons, he has created the Texas Juvenile Crime Prevention Center at Prairie View A&M. So without further ado, I'll turn it over to the video for Texas Senator Roy West.
I'm State Senator Roy West. For far too long, our communities of color have endured the effects of institutionalized racism. We must use every avenue and tool at our disposal to dismantle the cycle of bad policymaking that results in racial inequities for generations to come. While Black people only make up 13% of the US population, they are 33% of the prison population. Black youth are 14% of the population, but make up 42% of the youth detained in youth detention centers and youth prisons. There's so much work that needs to be done, and it needed to be done yesterday. I filed Senate Bill 108 to serve as a legislative tool to combat bad policymaking that perpetuates racial inequities. Senate Bill 108 requires representatives of state agencies to prepare a childhood racial disparity impact statement for any bill or joint resolution pending before the legislature that directly affects the agency at the request of the Lieutenant Governor or the Speaker of the House of Representatives. Each statement must include a brief description of the nature and effect of the proposal, how the legislation will directly or indirectly impact racial disparities among children, and justification if such agency statement chooses to omit the information. This is just one tool that we can use, but the reality is I'm going to need your help in order to make certain that this bill passes. I'm State Senator Royce West, representing the future of the state of Texas.
Thank you. And as Senator Roy West requested, we can all support that bill. I want to turn it over for some closing remarks from Leah King. And Leah, I'm going to give you a quick intro and then I'll turn it over to you. So Leah King was named the President and CEO of United Way of Tarrant County in November 2019. She's a passionate advocate for children, which I can attest to, and active in the community. She currently serves as a director for, in addition to her president and CEO responsibilities, she currently serves as director for Cook County's, for Cook Children's Medical Center and on the Board of Governors of the Fort Worth Club. You're a founding member of the United Way of Tarrant County's Women United and currently serve as the Women's Fund Development Chair, which I know Houston, we've had that. So it's great to hear that Tarrant County has one as well. I will hand it over to you, Leah, for some closing remarks.
Great, thank you. And thank you so much to all of our fantastic speakers today. And just for everybody that attended this incredible summit. And special thank you to Children at Risk and the Texas Racial Equity Collaborative. All I can say is, wow. I'm just blown away for what all we have had the pleasure of hearing and learning today. We heard so much about racial disparities in maternal and child health care and just the risks that impact all of us. And a great reminder that little Black lives matter too. We heard about the disproportionality of the number of children in the juvenile justice system and compared to the white peers, often experience, their white peers often experience greater leniency in application and interpretation of the law and sentencing. And this sets so many of our young people up for just a long-term struggle. We have to recognize that the same systems, whether criminal justice, school, law enforcement, medical systems, provide entry to the child welfare system and entry to the juvenile justice system as well. There are so many youth who cross over amongst all of those systems, and we learned about that and heard about that from some of our speakers today. And we heard about what the repercussions long-term can be. But we had also an interesting discussion on how we begin to move beyond just the conversation and get to, all right, what's next? What do we need to do? And it starts with recognition and acknowledgement that we haven't really focused on this issue truly. We've spoken on the surface of it, and we've focused on individual levels, but not really at the structural and systemic level. So we need to begin to shift the conversation from trauma to healing. And we talked about healing-centered engagement as informed care. We heard a lot about the economic impact of fully engaging the Black community in the education sector and what it means to employment and financial stability for families. Having the reminder that Black workers still only earn 70% of what white workers earn, and really the major gaps of connectivity, transportation that continue to hinder our young people from having access to good jobs. We did hear about a promising program developed to produce a pipeline for students to participate in internships in banking. So special shout out to Texas Southern University for their focus on success at producing, focus and success, should I say, at producing accounting and banking professionals. That's going to be crucial to make sure that the more than 50% of Black businesses that don't have a banking relationship begin to feel more comfortable in establishing them. We heard a number of soul-stirring presentations and some incredible research to encourage us to correct the narrative, especially on Black males who are doing well, and to contradict that, that narrative that we hear over and over again to the contrary. It was really disturbing to hear about having access to better data on Black males who are incarcerated than on those who are performing well in high school. And for those who are participating today and from seeing the activity in the chat, I know that all of us will work to do something about that. And if nothing else, can we just talk about the Black-White doll study? I don't care how many times you've seen that video or different iterations of it over the years. I don't know if it's possible to see it without feeling immense pain and anger and resolve. Our children are fighting to be seen, and we have to bring them, and I loved this phrase, a curriculum of affirmation so that they can grow that self-love from within. So for all of us, we have to continue to do the work to help students understand their worth, like organizations such as Carter's House is doing. We need to help our children know their value and to know that beyond anything else, they are loved, they are seen. And as we were reminded and shared with us from Dr. Simmons, hold aloft the vision of what we can be. We thank you for being with us today, and we wish everybody a great rest of your afternoon.
Thank you all. Just to take a look at the chat for surveys, they're going to put up some slides on the social media handles to follow all of the folks that you've seen here today. And lastly, please join us for our Racial Equity Today if you have Racial Equity Advocacy Day tomorrow. So Dr. Bob, give a plug on top. Leah, I'll give a plug on the bottom. And thank you and have a great afternoon.